Good morning. My name is Patricia. I am going to be your guide on this journey. Everybody knows me as Miss Patty. That's kind of the name that I'm known by for your CNA. We are the #1 CNA training channel on YouTube. We are used in schools, colleges, training centers, and facilities nationwide. The book that you're going to be using was written by me, and it is the 3rd most used CNA book in the country. So you are going to be learning principles from a subject matter expert. I'm going to make it easy. And at the end of 4 weeks, and the 4 weeks is going to go by super fast. But at the end of 4 weeks, you're going to be thinking, that was a little too easy. Did I learn what I needed to learn? And the answer is yes, you did. You will be well prepared to take the state exam. But my goal is not to overcomplicate it and make it seem incredibly hard. There are some instructors that do that so that you think that they have this mystical knowledge, or that's not my goal. My goal is to make it so easy that you're like, well, that's easy. I can do that. So it's deceptively easy. Understand that you are learning a lot of information, but I'm just going to present it in a way that just makes it make sense. Okay, sound good? Sound good? I got a ton of resources to help you out on your journey. We're going to go through those as we go through today. I am going to talk nonstop until 1 o'clock. I will give you a 15-minute break in there. Other than that, I am going to talk nonstop. You don't need to take notes. I've already taken all the notes for you. I'll tell you where to find those notes for each lesson that we're going to go through. All you have to do is sit there and stay reasonably awake. Sound good? Easy? Okay. This is Jake. He runs all of my tech. If you attend virtually, so if for some reason you can't come to the next class 2, for whatever reason, you have a flat tire, can't find a babysitter, or whatever the case may be, and you tune in virtually, if you click the little thing that says view on YouTube, and you go to YouTube and you type a comment into YouTube, it will show up on the screen. And I'll read the question out and I'll answer it. So you can get your questions answered even if you're not physically in this room. Now you will see, because we're going to have lots of people joining us virtually, you will see, I've only got 4 on right now. You will see people that will type stuff in, and Jake will put it up on the screen, and we'll congratulate those that let us know that they passed their test, and answer the questions as they come up. Okay, good. Good. Does anybody have any questions before we get started? Anything pressing that you want to know? All right. So this class is going to meet on Mondays and Wednesdays, not Monday through Wednesday, Monday and Wednesday. If you show up tomorrow, I won't be here. Okay. So Mondays and Wednesdays from 9 to 1 for 4 weeks. We don't take holidays off. If that came up last session, if we're scheduled to have class, I'm here. We're having class. If it's a holiday and you can't show up, that's fine. Show up virtually. But I'm going to be here for the next 4 weeks on Mondays and Wednesdays. And that's because healthcare works even on holidays. We don't get holidays off in healthcare. So it's something that you kind of have to be aware of. Sound good? You can attend in person, just like you are right now, or you can attend virtually. I'm going to tell you how to attend virtually in just a few minutes. And you can ask questions while you're attending virtually. The replays are going to be located on flcnatraining.com. Now, this is also on that blue paper, the paper with the blue heading. That's called what we call the day 1 paper. Don't lose that, because it's got a lot of really useful information that you're going to want to refer back to later on in the program. So try not to lose that paper. But on the bottom of your syllabus down here, you've got 3 QR codes. Do you guys know how to use QR codes? You just open up your camera, point it, and a little yellow box will show up. It says open in whatever your preferred browser is. Just click on that. So the very first one is FLCNA training. I know it looks small, but I tried it on my camera. It does work. It does work. So that FLCNA training, that QR code will take you directly to where the replays are. So it's always right there on your syllabus, your ability to get to those replays. Sound good? The next 2 QR codes we'll talk about in a little while. You are going to get a review sheet at the end of every class. These review sheets are extremely helpful. If you fill out that review sheet while the information is fresh in your mind, it helps kind of cement it in, right? There's a correlation between writing what you're learning as well as listening and viewing. And if you write on these review sheets and fill them out as you're learning it, it'll help kind of put that information into long-term storage. But then those 8 review sheets become your review packet for the state exam. And I just have heard from a couple of students that a couple of classes ago that said that they actually had their review packet in the car, and it made their test just go super easy because they reviewed it really quickly. You know, as they were waiting to test, it refreshed all their information and they tested beautifully. So they really do work. If you attend virtually and you don't physically come to class, because Jake's going to pass them out at the end of every class in here. But if you're at home watching because you couldn't make it to class, they're right there by the door. You can grab the review sheet that at the top it says class 1, 2, 3, 4, 5. Grab the review sheet that you need on your way out. That's for you guys. But you can also on flcnatraining.com, you can download it and print it at home as well. Okay. So lots of resources for you. And then at the end of every class, we're going to send you an email. We call it the wrap-up emails. And those wrap-up emails are going to have links to all the videos that we showed in class. It's going to have links to any important topics that we talked about in class. And it's going to have your next steps as well. So we cover all bases. So even if you do kind of fall asleep a little bit in class, you're going to have a wrap-up email to cover what you missed along with the replays. Good? Good? All right. You also get access to the online course that we're going to talk about a little bit later today. That online course is going to help you put into practice what you're physically learning. We have 2 books that we're going to use in this class, and we're going to go into this a little bit more in depth after break. But for right now, just know that we have 2 books. The yellow book, you're going to give back to me on the last day. Okay. The yellow book comes back to me on the last day. So don't highlight in it. Don't make notes. It's not yours. You'll take it home. You're going to have it for 4 weeks, but you're borrowing it. The other book, the spiral book, that's yours. You're going to write in that. It's a workbook style. This is the only one that we use in class. So the spiral book is the one you want to bring back and forth to every class. The yellow book is just for homework reading. So take it home, leave it there. We don't work out of that book. It's not my favorite book. I mean, it kind of goes over the basics. It's stuff that you do need to read because it's not always stuff I'm covering in class. So homework is homework. We can't get away from that. But it's boring, guys. It's a textbook. It's boring. There's nothing exciting about it. So we don't work out of that one. Now, the yellow book in front of you has a number on it. It'll start with a Y. When I read your name, if you can tell me what your book number is. When I read your name, if I say your name wrong, let me know how to say it, and I'll try to correct myself. And if you want to be called something else, like a nickname, let me know. Okay? Emily? Y10. Thank you. Michaela? Y3. Tiana? Y2. Mia? Y7. Autumn? Y8. Yenison? Ashley? Y1. Eliza? Y2. Ariani? Y20. Did I say that right? Christia? Did I say that right? Christina. Okay. Oh, is there an N in there? Yeah. Christyna? I just did a typo. Jake, please make a note. Madison? Ashanti? Thank you. All right. So to recap, yellow book goes home, stays home until the last day. Spiral book, bring back and forth to class. That's the one we're going to work out of. When I say book in this class, I'm always referring to the spiral book. Always. All right, so let's dive right in. In order to be a CNA, we have to know what does it do. And I'm going to show you a video here in just a few minutes. It takes about 15 minutes. It's an animated style video to explain to you the role of the CNA. How do we know what to do with each patient? What is our scope of practice? What are we allowed to do and not allowed to do? So it's going to cover some really foundational principles that we're going to build on. You can fall asleep for anything else in my class. Do not fall asleep for this video, because we are going to build on this video every step of the way. Everything that comes after this starts here. Sound good? If you go to page 17 in your spiral book, so on the screen, you can always see the book I'm referring to. It'll be up in the corner, the spiral book, and it'll show you a picture of the page. So page 17. This is what we call a principle. A principle is a group of actions that is going to be repeated across several skills. So in this case, you can see that skill rules is going to apply to every skill we do. Every single skill we do revolves around this. So we have to learn it. It's our foundational principle. If you see this at the bottom, it says that I have a video on that, and that's the video that you're going to watch. Now, these videos are also available on my website for free on foryourcna.com. You can access this video under animated lessons. But everything that I talk about, I have a video for. Most of the time in here, I'm going to be talking to you. But there are a few videos I'm going to bring in and show as well. So this is one of them, because a picture really is worth 1,000 words, right? So these are the notes for the video, page 18. Remember, I said you don't have to take notes. I've already done that for you. So page 18 and 19 are going to cover the notes from this video. All right. The video itself is going to talk to you about a concept called activities of daily living. And if you want more information on activities of daily living, we can find the notes for that on page 89. You don't need to turn to that. You can just stay on 18. That's fine. Just so that if you watch the replay, where was that? It's also on your syllabus. Hold on. I know it's in here. Oh, it's on your syllabus. We're going to talk more about activities of daily living next class, but it's right here in this last column. So it'll tell you what page to go to for that as well. All right, so we're going to go ahead and put this video on. This is our starting point, our jumping off point. Well, welcome those of you that are joining virtually. Jake, you can go ahead and start the video.
The care plan and the CNA. Why it's always about the care plan. A presentation brought to you by foryourcna.com. Thank you for joining For Your CNA's online CNA Test Prep. We will be preparing you for both the written and skills portion of the exam. This course contains videos, interactive lessons, activities, testing care plans, test registration instructions, practice questions, and much more. This program goes way beyond our skills videos available on YouTube. But in order to pass the test, there is one single principle that you must understand: the importance of the care plan. Without this key, learning the skills is meaningless. You might be able to mimic what I do in the skills later, but chances are you will fail the test because you didn't follow the care plan. So this course will teach you the skills, but you must first learn how those skills need to be done. So come on inside and I'll explain to you how the care plan works and why it is so important to the test. We are sure that you will become great CNAs and you will provide excellent care for our residents. But before you get started, let's review some basics. Does anyone know what the initials CNA stand for?
Certified Nursing Assistant?
That's exactly right, April. A nursing assistant is there to assist the nurse. You will be receiving all of your instructions from the nurse and must follow their directions. This will probably include taking vital signs and assisting with personal care tasks. But you may also be asked to assist with other nursing procedures as well. It is important to only do the things that you have been trained to do. If you aren't sure how to do something, ask someone for help. It's okay to not know everything. But please, don't try to do something that you aren't familiar with. It might harm the patient. In this online CNA Test Prep program, we're going to show you how to do all tested skills. But that is only the beginning of your education. You will learn way more on the job. Because every patient is different and will have a different way that those skills need to be done. And that's where the care plan comes in. As a CNA, you will be expected to assist our patients with many routine tasks. Generally speaking, CNAs help patients with things that they can no longer do for themselves. Things like sleeping, toileting, grooming, bathing, dressing, eating, socializing, and activities. Together, these are called the Activities of Daily Living, or ADLs. These are things that everyone does every day for a healthy life. But not all patients will be able to do these things for themselves because of illness or injury. Sometimes people are too weak to go to the bathroom on their own or feed themselves. And that's where you come in. If a patient needs help with any of these tasks, you will be there to help them. But not all patients will need help with all tasks. This is Henry. Henry had a stroke and has right-sided paralysis. And this is Martha. She had a left hip replacement. This is Bob. He has had a recent leg amputation. And Annie has dementia. And they will all require different care. Some patients will need help brushing their teeth, but others will do that themselves. As a CNA, we will help the patients do the things that they cannot do alone. But we will let them continue to do the things for themselves that they can do.
How will I know what I'm supposed to do with each patient?
I'm so glad you asked, Cassie. As the registered nurse caring for these patients, that's my job. When a patient gets admitted to our facility, I will do a head-to-toe assessment. I will review all body systems to evaluate the patient for real problems and potential problems. This is a very long, complicated process, but here's a brief overview of a general assessment. I'm going to look at his neurological status. I'm going to look at his cardiac status and his respiratory system. I will also look at his integumentary system, which is hair, skin, and nails, and his gastrointestinal system. His urinary system is important, as is his musculoskeletal system. And then I will review his endocrine, lymphatic, and reproductive systems. And finally, I will review the doctor's orders for this patient. I will use all of this information to determine the patient's real and potential problems. Here's an example to put it into perspective. Let's say that this patient has just had a right hip replacement. Now we know that she will need to continue her activities of daily living. She still has to eat, drink, go to the bathroom, bathe, groom, and dress. And after my assessment, I know that she did all of those things herself until today. However, she cannot get out of bed for any reason for the next 3 days. So, since we know that she must stay in bed, I have to figure out how to meet all of her ADL needs. The easiest way to evaluate basic needs is using the TEAMS method: toileting, eating, ADLs, mobility, and special. As the RN, I'll take all the information I gathered during the assessment to figure out the best way to help her. She can't get out of bed, so I have to figure out the best way to meet her elimination needs: bedpan or catheter. I also know she is at risk for constipation, Since she's not moving much and she's on pain medication, this is a potential problem. She can feed herself, but the trays must be brought to her in bed. She can't sit all the way up because of surgery, but she can't eat lying flat either. She has dentures, so they must be within reach at mealtimes, and they must be cleaned daily. She's able to clean herself as long as the supplies are brought to her, but she can't reach her legs or feet, so she'll need help. She is on total bed rest for 3 days, and she also needs her dressing changed every day. You can see how the RN uses all the information available to create a plan of care specifically for this patient. This is called a care plan, and it's something that only an RN can do. Of course, this was a simplified version of the care planning process. A real patient's care plan is much more extensive. Every single aspect of her health, condition, and ability level will be evaluated in order to help her. Even the smallest decision can have long-term consequences. The RN will write a detailed care plan for the entire healthcare team to follow, and the care plan must be followed exactly.
So every patient will have a different care plan?
That's correct, Ben. Every care plan will be different because every patient will be different. Even patients that seem alike because they have a similar diagnosis or have had the same surgery may have differences in care. CNAs don't have enough education or experience to know all the differences. So as a CNA, your job is to read and follow the care plan for every individual patient. In fact, you could say that your job is to follow the care plan, the whole care plan, and nothing but the care plan. Do you think you can do that? Can you follow directions exactly?
I can.
Absolutely.
Sure, yes.
Awesome. Then you're well on your way to being a great CNA. But helping patients with ADLs isn't all that you will do. You are also there to help the nurses by making observations. The CNAs are the hands and the feet of the patient. If the patient is cold and cannot reach their sweater, you will get it for them. If the patient can't brush their own teeth, then you will do that for them. If the patient can't get up to shower, then you will help them stay clean. You will become their hands and feet to help patients with things that they can't do themselves. But you are also the eyes and the ears of the healthcare team. You will report everything you see, hear, smell, or feel to the nurse. This is the most important task that you have as a CNA. If you see redness around a wound, you must report it. If you hear the patient wheezing after walking to the toilet, you must report it. If you feel that a patient's skin appears warmer than usual, you must report it. If you notice that a patient is coughing when eating, you must report it. As a CNA, you will be spending much more time with the patient than the nurse does. So you will be in a position to notice a lot more about the patient. The nurse needs this information to make decisions about the patient's care. Reporting these observations gives the nurse another assessment opportunity. That new assessment may even change the tasks you are assigned to perform. This is called the nursing process, and here's how it works. The RN assesses the patient and develops the care plan. This gives you specific tasks to do. While doing those tasks, you notice things. You report those observations to the RN, and the RN performs another assessment to review the changes in the patient. That new assessment prompts changes in the care plan, and this gives the CNA new tasks to do. And the cycle continues around and around as the patient gets better or worse. This is a continuous process until the patient is discharged.
I'm not sure I understand. Are you saying the care plan is going to change all the time?
Yes, it could, depending on the needs of the patient. Let me give you an example. The care plan told you to make an occupied bed in room 201. As you changed the sheets, you noticed that the skin on the patient's backside was red and irritated. You notified the nurse, who then reassessed the patient. The nurse decided that the patient needed to be repositioned every 2 hours around the clock. This was added to the care plan as another task for the CNA. Using this model, we can respond to the needs of the patient quickly as their needs change. But it also works for patients that are getting better too. You've been assisting Mr. Hopkins with transferring out of bed and into a chair after surgery. But you notice he isn't leaning on you any longer. You notify the nurse. The nurse reassesses the patient and decides that the patient can transfer on his own now. The care plan is changed, and this task is removed from the care plan since the patient is improving.
Doesn't this mean that I'm going to be bothering the nurse all the time? Won't they be annoyed?
The nurse should never be annoyed with you for reporting changes in the patient. They are legally liable for every aspect of that patient's care. Since the nurse requires that information to plan the patient's care, they expect to receive updates from you on the changes that you see. But how often you will have to report changes to the nurse will depend on the setting you are working in. Nursing home patients are pretty stable and don't really change all that often. That's pretty common for long-term care facilities, like nursing homes and ALFs and even home care. But in other settings, like hospitals, rehabilitation centers, and hospice, patients' health can change rapidly. In those settings, nurses and CNAs are going to work closely, and constant communication is required. Since CNAs must follow the care plan and are not allowed to alter it, they can't solve problems. The RN is ultimately legally responsible for the care of that patient. If you have information about the patient that you're not giving to the nurse, the patient can suffer, and the nurse is legally liable for that. Remember, you are an assistant. You are there to help, but the nurse is always in charge of the patient. So all changes, regardless of how minor they seem to you, must be reported to the RN. When the patient is stable, you will not have much to report and may go days without talking to the RN. But if you notice something, then it must be reported, even if you don't think it matters. If you aren't reporting observations, the nurse can't rely on you anymore. And if the RN can't rely on you, then you aren't a good assistant to that nurse. You must report to the nurse everything you see, hear, smell, or feel. Be a good assistant and report all changes and observations. This is the most important job you have. So the care plan is developed by the RN, gives the team tasks, CNAs follow the care plan, and report changes. Let's recap what we learned today. Can you tell me how a CNA knows what each patient needs?
The care plan.
As a CNA, you follow the care plan, the whole care plan, and nothing but
The care plan.
anything unusual that you notice about the patient, you must report it to
The nurse.
Great job. For the exam, you will receive a care plan. What should you do?
Follow it exactly.
That's correct. If you don't follow the care plan, you will fail the exam. It's that simple. Now that you understand the care plan, I can show you how the skills will be done for the exam. But remember, you must always read and follow the care plan. That's a big part of the skills exam. Take the brief quiz below to make sure you understand. See you in the next lesson.
All right, watch your eyes. All right, any questions on that? You now have all the information you need to pass a state exam. We're at 9:30. Now, I still have a lot to teach you, but everything boils down to this. For the test, you're going to get a care plan. What are you going to do with that care plan? Follow it. If the care plan tells you to stand on one foot, what are you going to do? Stand on one foot. If the care plan tells you to wiggle your arms in the air, what are you going to do? Wiggle your arms in the air. That is the test. The test is looking to see if you understand your scope of practice. It really is that simple, because CNAs cannot make decisions for patients. You simply don't have all of the information. How can you make a good informed decision without all the information and the training to apply it properly? CNAs kill as many people as surgeons every year. We just don't talk about it. I think we should be talking about it. But the reason that that happens is because CNAs step outside of their scope of practice. So understanding your scope of practice really is what the test is all about. Make sense? So you literally have all the information you need to pass the state exam. You get a care plan, you follow it. That's it. What do you think you should do if you can't follow the care plan for any reason at all? Any reason at all? Who should you tell? The nurse. That's it. CNAs only have two doors. We either follow the care plan or we notify the nurse. So what if the patient refuses? What do? Tell the nurse. What if there's no supplies to do the skill? Tell the nurse. What if the patient can't do the skill? Tell the nurse. Yeah, now we may have to do it for them, but that would be on the care plan, right? So if our care plan says that our patient is supposed to brush their own teeth, right? That's what our care plan says. They do their own mouth care. We're not in their mouth. Good. Yay. We like those patients. Those are good. But you walk in there today and the patient can't brush their teeth. What do you think you should do with that information? Yeah, because the patient has changed. We expect a patient that can brush her own teeth. That's what our care plan is telling us to expect. But when we go in, that picture doesn't match what we expect. That means something has changed. And all changes need to be reported to the nurse so the nurse can figure out why. That's an assessment opportunity. Make sense? Good. So this really isn't a hard job, is it? We follow directions or we tell the nurse. How many of you guys remember playing Simon Says when you were a kid? You guys remember the rules of Simon Says? If Simon says to do something and you don't do it quickly, you're out. If you do something that Simon didn't say to do, you're out. So the only way to win Simon Says is to do only what Simon says quickly to win, right? So it's all about following directions. That's what this is. This is Simon Says. It's just the care plan. So as CNAs, we perform the skills on the care plan exactly as written. We don't change anything. We follow the care plan, the whole care plan, and nothing but the care plan. Now, that's kind of a funny saying, isn't it? Well, doesn't that all mean the same thing? Actually, it doesn't. So let's look at this line by line. We follow the care plan. Well, we just learned that. We follow the whole care plan because you will unconsciously pick and choose the parts you want to follow. You'll ignore stuff. You'll rationalize something. We can't do that. The care plan is as it's written, period. We don't get to change it in any way whatsoever. If your brain, and your brain does this, by the way, if your brain sticks in there, but what if? Yeah, but what if? You've changed the care plan. Does that make sense? That nurse has already taken into account the yeah, but what ifs and wrote down instructions. If you can't meet those instructions, you have to report to the nurse. We're going to talk about why in just a minute. Okay. So we follow the care plan, the whole care plan, and nothing but the care plan. Now, while we're doing that, we want to observe for any abnormalities, anything that you notice. If it looks funny, we're going to report it. If it smells funny, we're going to report it. If it sounds funny, we're going to report it. If it feels funny, we're going to report it. Anything that we notice, we are operating as an extension of the nurse. Remember, this is nursing assistant. There's nothing independent about that name. Nothing. Assistant. What does an assistant do? Yeah, they help. They assist. There's nothing independent there. So if you think that CNAs work independently, they don't. CNAs have to be an extension of the nurse. Well, that means that whatever you know, that nurse needs to know. Everything you know, that nurse needs to know. If you're feeding a patient and they're only eating like half of their food and you start to realize that they're not eating really well, who needs that information? The nurse. Absolutely. You are an extension of them. Good? Make sense? Okay. So we're going to make observations and then we're going to report those observations to the nurse. This is the first principle that we're learning, skill rules. And we're going to apply this to every skill that we learn from this point forward. Now, on the back wall, all of those banners, those colorful banners, these are the principles that we are going to learn in this class. And we're going to learn all of them by the end of week 2. You will know everything on that back wall by the end of week 2. You're not going to memorize anything. It's not about memorization. It's about learning. Learning why. Not just the step, but why. Now, be aware that everything on that back wall is not going to be on your care plans. These are things that you have to know as a CNA to be able to perform the skills you're assigned to perform on the care plan. Okay? So everything on that back wall is the behind the scenes that you're supposed to know. And we're going to go through them one at a time in detail, learning what we need to learn. We're going to learn 3 of them today. This is the first one. We're going to learn opening and closing toward the end of class today. But by the end of the second week, you'll know all of that. And then we're just going to rinse and repeat. We're going to use those principles to build some skills. Okay. So the skills toward the end of the program, they're easy because you already know everything you need to know to do the skills. We're just going to rearrange them a little bit, plug them in. And that's why the class becomes really easy. Okay. Good. Questions?
How many parts of the exam are there?
There's 2 parts of the exam. We're going to talk about that right after break in detail. I'm going to explain the whole exam process, but there's a written test and there's a skills test. And we're going to talk about each one and what they mean to us in just a few minutes. Okay. So remember our role here. Okay. The nursing process is the RN goes in and assesses the patient. As an RN, I assess you as easy as I breathe, right? I know more about you guys. I've never met you. I don't know you, don't know your names, but I can tell you something about each one of you just by being a nurse. We assess like we breathe. So as a nurse, I go in and I do assessments on my patients. I look at them head to toe. I'm looking for real problems, but I'm also looking for potential problems. And how do we prevent those potential problems from becoming real problems? I use that information and I create a care plan. Now, that care plan is going to give the entire team things to do, not just the CNAs. That care plan is going to talk to dietary about certain dietary restrictions or dietary changes that we need to make based on what's happening with the patient. If they have kidney disease, I'm going to talk to dietary about a renal diet. If they have diabetes, I'm going to be talking to dietary about a diabetic diet. Should they be on an 1,800 calorie, a 1,200 calorie, a 2,400 calorie? What kind of diabetic diet should they be on? What kind of meal plan should we be planning? Should we be limiting them to just 3 meals a day, or do they need regularly spaced snacks to keep their blood sugar level? We got a lot to talk about. I'm going to be working with physical therapy and occupational therapy and speech therapy to take care of this person's therapy needs. I'm also going to be talking to discharge planning because I can't stay here forever, right? They got to have somewhere to go. I've got to talk to CNAs about the things I need you to do for me so that it frees me up to do the higher level nursing tasks. And that care plan is also going to tell other nurses what I expect them to do with this patient. So we're all on the same page. And one nurse isn't doing one thing and another nurse is doing something else that's contradicting. So it is a plan of care. We just call it a care plan. So that care plan is going to tell everybody on the team what their role is and what I expect done with this patient so that we're all working together in a coordinated manner to get this patient to the highest level of function possible. Make sense? So while you're performing the skills that you're assigned to do, you should be making observations so that we know whether this patient is advancing and we can get rid of some skills, or not advancing and we have to maybe regroup and think in a little bit different direction. So your communication with the nurse is going to be very integrated. Good. If you find yourself working in a place where it's you versus the nurse, who do you think is going to lose in that scenario? Yeah, the CNA is going to lose, but who's really the one losing? The patient. That's right, because we're not all on the same team. If you're spending all your time fighting me, nobody's fighting whatever's trying to kill this person. Make sense? So be careful about ego. Be careful about cliquish behaviors. We have to all be aware of why we're here. Okay? And when we get out there in the workforce, it's really easy to start overinflating our own sense of worth, not just at the CNA level, but the RN level and the physical therapy level and every other level. We want to make sure that we're all working together as a team to give this person the best possible outcome. Does that make sense? Good. Otherwise, they're the ones that are going to suffer. All right. So one more time, CNAs follow the care plan, not just the care plan. It's the care plan, the whole care plan, and nothing but the care plan. We make observations, and then we report those observations to the nurse. So let's do a little activity to see if we've learned what we needed to learn before we move on. So if you go to page 20 in your book, now remember your spiral book you can write in. There's some pens on the table in front of you and the little coffee cups. So grab a pencil or a pen or whatever. And I want you to take 5 minutes and answer the questions on page 20. For those of you joining us at home, it's this book, the spiral book. When you're done, if you can put your pen down, that way I just know who's still working and okay, we're going to go ahead and move on. Boy, they're having a lot of fun next door. Okay, so let's take a look at page 20. There's 8 questions there. I want to go through these really quickly and make sure that we're all on literally the same page here, okay? So number 1, you receive the displayed care plan. How far will you walk this patient?
10 steps.
Why? Easy answer here. Why? It's what the care plan said, 10 steps. Did anybody say until the patient gets tired? Anybody think that was a good idea? Why isn't that a good idea? Because it's not on the care plan. Okay, but your brain could very easily say, yeah, but if they get tired, remember, we follow the care plan. If we can't follow the care plan, who do we tell? The nurse. All right, so number 2, you receive the displayed care plan. What is required to assist this patient to stand? So a gait belt or transfer belt. Did anybody put a walker or 2 caregivers? Anybody put those? If your brain, and sometimes our brains do funny things without our permission, but if your brain said something to you like, yeah, but what if they have trouble standing? Or, but what if they're weak? Or, but what if they have balance problems? If you change that scenario in any way by putting a but what if in that question, you would have chosen a different answer. This is important because on the state exam, your brain is going to try to put in information that does not exist. So you got to learn pretty early. Don't change the question. Good? Make sense? Okay. So let's go down to number 5. You receive the displayed care plan. What is a safety concern for this patient? What do you guys think a safety concern is? How do we know that? Okay, so it doesn't matter what our eyes say to us, does it? The care plan says they're in an inappropriate position. So what do you think we need to do before we feed this patient? Reposition. And we're going to do that because our care plan said they're in it doesn't matter what our eyes tell us. Our care plan is telling us whatever you see, they're not in the right position. Sit them up. Good. Okay. Now let's go on to number 8. This is the most failed skill on the state exam. Measure, record a pulse. The most failed skill on the state exam. It's one of the shortest skills. It is a ridiculously easy skill. I'm going to teach you how to do it. There's nothing to it. It's not hard at all. Why in the world is this the most failed skill on the state exam? And it has everything to do with the care plan. So if you look at number 8, how long do you need to count for? Can somebody give me the answer? Why? because it's what the care plan said. So if you count for anything other than 1 full minute, if you take a pulse anywhere else but the radial pulse measured at the wrist, you will fail this skill. So students often for the test try to get fancy. They try to show the evaluators, hey, I know more than this care plan is asking me to do. So let me show you. Let me show off a little. And they'll grab a stethoscope and they'll listen to the heart and count the heartbeat. Is that following the care plan? So what do you think that does to their score? Fails them. Not because they didn't get the right number. The number has nothing to do with it. Why did they fail? They didn't follow the care plan. They don't know their scope of practice. Does that make sense? So these skills that you're going to do are going to show those evaluators a whole lot more than you think they're showing them. You're being graded on following the care plan, not how well you take the pulse. Do you guys understand the difference there? If you don't have that secret, everything that I show you from here on will make no sense to you. Good. And again, that is the secret to the state exam. You now have the secret that you need to pass. So knowing that for the test, you are going to get a care plan and your responsibility is to read it and follow it. Wouldn't you want those care plans before you go to the test? How many of you guys want the test and care plans? Anybody want the test and care plans? You'd like to know what they're going to say, wouldn't you? Well, there's 4 of them right there. These are the actual testing care plans. So if you get ambulate the resident for one of your skills, that first one is exactly what it's going to say word for word. These are the actual testing care plans. Now, the problem is that we're going to have to do 20 skills and you've only got 4. You want the rest of them? Go to page 25 in your book. For the exam, you are going to be asked to do 3 clinical skills. And they're going to break these up or group these together, I should say, in groups of 3. Each one of these sets of skills, set of 3, is done in a very specific scientific way. Each one of these care plan sets has one ADL skill on it. Do you guys remember what ADLs were? Activities of daily living, things you do for yourself every day. Bathing, dressing, grooming. 1 mobility skill where we have to move the patient in some way. So range of motion, transfer from bed to wheelchair, ambulate a resident, turn them over in bed, some sort of we are moving the patient skill. And then there's going to be 1 documentation skill. Everybody gets a documentation skill on the state exam. There's 4 documentation skills. There's pulse, respirations, feeding, and drainage bag. You are going to get one of those 4. Guaranteed. You will either have to do pulse or respirations or feeding or empty the drainage bag. You're going to get one of those 4 because everybody gets a documentation skill. And then you also get 1 ADL skill and you get 1 mobility skill. So they use this blueprint to create skill sets. And for the test, there are 11 skill sets. You are going to get one of these clipboards for the exam. This is exactly what the care plans are going to tell you. Exactly, word for word. So you now have the secrets to what to expect on the state exam. You know that you're supposed to follow the care plan, and now we have the actual care plans. So boy, this test is really getting easy, isn't it? We still have to learn how to do the skills according to the care plan. And we're going to get to that as we go through the program. But I guarantee you that if you read the care plan and just gave it your best shot, you'd probably do okay. As long as you put your patient first. Good? Questions? So each one of the care plans on page 25 is going to have one ADL skill, one mobility skill, and one documentation skill. And all of that is detailed at the bottom of page 24 for you. So for those of you who want to know what constitutes a mobility skill, I've got them here. What constitutes an ADL skill, I've got them here. What is a documentation skill, I've got it there for you. You don't need to know this. This is just kind of nice to know what to expect on the state exam, but this is just kind of extra fluff. But there it is for you if you need it. Now, in this class, we have these yellow care plan sets. Do you see it up there on top of the, let me get it. This is our testing care plan set here. For the exam, you're going to get one of these. Mine are a little bit fancier. I have it on like the little care plan thing, and there's some background images. I just made them look pretty. For the exam, it's just going to be the words on yellow paper. Very boring, but they are laminated, but very boring. I like color. I like to fancy things up. But when you're practicing in here, we're going to talk about practice a little bit later in the program, but right now you don't have enough to practice. It's not relevant to you yet. It will be shortly. But when you're practicing, you can use these. They're always up here on my bookshelf. Grab this, pick one, and then do the 3 skills on it to have a dress rehearsal for the exam. When you do that, on the back side of the skill set that you're demonstrating are the actual testing checkpoints. The actual checkpoints. So if you're practicing, it's best to practice in groups of 3. So let's say that you 3 form a group and you're practicing. You're going to do the skill and you pick this one. Okay, you're going to do skill set 10. So your skill set is measure, record pulse, perform passive range of motion to elbow and wrist, and provide a partial bed bath. You're going to be her patient for these skills because you need somebody to do them on. So you're going to be a patient, except for partial bed bath. We're going to do that on a mannequin. We'll talk about that in a little bit. You're part of the group. So what are you going to be doing? Well, you should have your book with step-by-step instructions so you can prompt her if she gets stuck. Or a little later, when you guys have a little more experience behind you, you should have the checklist in front of you. So as she's doing the steps, you can be checking them off. And then at the end, you can tell her what she missed. You guys can have a dress rehearsal for the state exam long before you get there using this. Now, we do sell these. If you want your very own copy, like if you're not going to be practicing here, you're going to be practicing at home, you can get your very own copy from Jake for $35.99. Now, online, I sell these for like $49.99. So I'm giving you guys a discount. Everything that you purchase while you're in the program, you're going to get a discount on. We'll talk about some other things that we have to offer you as well. You don't need it as long as you're in here practicing. Use mine for free. Okay. But we do have them available for you. Holly says, good morning. Wanted to let you know that I passed the state exam on Thursday. Thank you for your help. Congratulations, Holly. Great job. We're very proud of you. All right. We also sell a little pocket size version of these, the test and care plan sets, and those are only $6, $5.95. I don't sell those to the public. That's just for you guys. All right. So any questions on activities of daily living or the care plan? Any questions on those 2 topics? We pretty comfortable with that? All right, so we're going to move on now to your scope of practice. And we've talked just a little bit about this, but what is our scope of practice? Our scope of practice defines what we're allowed to do as a CNA. What are you allowed to do? What are you liable for? Okay, so if you do something wrong, how liable are you? How likely is it that somebody's going to come after you, either criminally or civilly? So this is an important topic, so we have to understand this. One of the things that CNAs need to understand is that as long as you operate within your scope of practice, you are not liable for anything. So as long as you're operating within your scope of practice, you are not liable for anything. But somebody has to be. So who's the person that's liable? The nurse. Nurses accept liability for everything you do. So as a nurse, if I have 6 CNAs working under me, I am accepting responsibility for what all 6 of those people are doing for my patients. And this is why it's so important that you and the nurse need to be working together. Because if I'm the one accepting liability, I need to know what you're out there doing. But I also need to know what you've observed while you're doing those things, because I'm the one that's liable for that information. Does that make sense? Good. So CNA liability is kind of one of those topics it's hard to wrap your head around. So I created a graphic because I'm all about colorful. And the graphic for this is called the Happy CNA Place. You can see it on the bottom of every single one of those banners. I got a big version of it over here. This is the Happy CNA Place. This is your scope of practice. And the foundation of this is the care plan, the whole care plan, and nothing but the care plan. That's our foundation. Everything starts there. And if we don't understand that, we don't have a scope of practice. But we have to have some firm guidelines to keep us inside our scope of practice. And those guidelines are CNAs do normal and principals guide performance. So let's talk about the first one. CNAs do normal. What does that even mean? CNAs, by law, this is a law, this is a state statute. So it's important that we understand that there are laws that govern this. CNAs are allowed to do routine tasks on stable patients that they have been trained to perform according to the care plan. So what does all that mean? Well, that means that we have to do routine tasks. So these are things that are no surprises. Okay, we're going to brush teeth. We all know how to brush teeth. We're going to be trained to brush teeth here. Bless you. Here. There's no surprises when you brush teeth. Brushing teeth is brushing teeth. I should expect no surprises, right? So that's a routine task. Something that is mundane, boring. Don't expect any strange anythings, right? But it has to be done on a stable patient. This is why you don't see a lot of CNAs working in the ICU. Occasionally you'll see 1 or 2, but very rarely, because we have to work on stable patients. Again, no surprises are expected. So let's go back to mouth care for a second, right? Everybody, have you brushed your teeth this month? Anybody? Awesome. Good job. All right. So you're somewhat familiar with the process, right? Get a toothbrush wet, put some toothpaste on it, scrub, rinse, dry. Pretty much the process, right? Nothing surprising there. But what if our patient was just in a motor vehicle accident and crushed their entire face, and they've got 62 broken bones, and I need their mouth care done? Is that a stable patient? Is there a possibility that there could be a surprise? Is there a possibility things can go way off track with this patient? Is that a CNA task? No. So even though mouth care is a CNA task, we have to have a stable patient to perform that mouth care on for it to be a CNA task. Good? And then you had to have been trained to do the task. Like, you can't pull up a YouTube video and self-learn. I mean, YouTube is great. It'll teach you a lot of stuff. I have learned a ton of stuff on YouTube. I have the #1 YouTube channel for CNA training, right? So we're really big into YouTube. But that doesn't mean that that alone constitutes training. because it'll show you some things, but you don't know what you don't know. What information didn't you get that you should have? There's no way for you to identify that. So training can be at the bedside. So a nurse can take you aside and say, hey, I want to train you to do this. I show you how, I watch you do it, I answer your questions, I make sure the patient's stable, all of that. It's on the care plan. That can be training. Training can also be in a classroom environment like this. So training can be done in a couple of different ways, but you still have to be trained by somebody who has a higher level of knowledge than you. Make sense? Okay. Now there's one more part of that CNAs do normal that we haven't talked about, and that is the role of the employer. Just because mouth care is a CNA task, it's something that's routine that you know how to do, you've been trained to do it, it's a stable patient, doesn't mean that the facility is comfortable with you performing that task. So what if we're in a facility that has a unit where we have patients with swallowing difficulties? Now, this is a normal skill, right? Mouth care, normal. Patients are stable. They're stable, but there's a higher level of complexity there that I'm not comfortable with my staff performing that task. I would rather have the nurse perform that task in this setting. Does that make sense? Okay. So the facilities are going to determine what tasks can be done at which level in their facilities. And that's going to be part of their policies and procedures. So CNAs have to follow that. And the nurses are the ones, because nurses delegate, they make the care plan. Nurses are the ones that are going to have to know what tasks can be delegated. Does that make sense? Okay. So as a CNA, we just want to make sure that it is a normal task, a routine task, that our patient is stable and that we've been trained to do it and it's been assigned to us. Good. Let me explain to you what happens when this goes off the rails. So this is a real life scenario that just happened up in Marion County, not too far away, Ocala. About 2 years ago, there was a nursing student. Okay, so not a nurse yet, a nursing student that they were in the hospital doing clinicals. And this nursing student had received instructions that don't do anything without the nurse's permission. The nurse is there to let you know what you're supposed to be doing. You know, you have to go by the care plan, all those same rules you guys just learned. Well, the nursing student is in the facility. Call light goes off. The nursing student goes into the room and asks the guy, what can I do for you? And the guy said, I'd like to get up out of bed. My back hurts, or whatever the case was, but I want to get up out of bed. And the nursing student said, oh, okay, I can do that for you. No problem. Nursing student did not know the care plan for the patient. Had no idea if the patient was supposed to stay in bed, was supposed to get out, how many people were required to assist them out, what tools were required, had no information about this patient. Answered the call light, patient says, I want to get up. The nursing student said, okay, I'll help you up. As the nursing student helped the patient up, patient fell, hit his head, and died. Who's at fault? Do you think the nurse that was taking care of that patient wants the liability for this nursing student who was totally off script? Do you think they're going to take the liability for that? No. Nursing student was the one liable. But nursing students aren't licensed. So ultimately, it was the instructor that had to take the liability. And even though the instructor told the student, you followed the care plan and the student didn't, the liability went back on the nurse, on the instructor, and ultimately the school. So it's the first case in the country where a nursing school was sued. And it's right here in our backyard. And they were forced to settle out of court. This liability, this issue of liability is big. And it's going to be on the state exam because it's relevant. We have to understand that as CNAs, we follow the care plan. If there's a call light and you don't know anything about that patient, you need to make sure it's not an emergency, right? Answer the call light. Is there an emergency? But you can't help that patient if you don't know what the care plan says. So once you realize, okay, they're breathing, they're upright, there's no emergency, let me go find the nurse to help you. Good? Make sense? If you don't have the information, you can't help the patient. So on the other side, so that keeps us firmly in our scope of practice, right? Now we know our patients have to be stable. It has to be a routine task. I have to be trained, and it has to be assigned to me, right? We know that. So on the other side, to keep us firmly in our scope of practice, is principles guide performance. So how do we transfer a patient from bed to wheelchair? How do we do range of motion? How do we do mouth care? What do I need to know? How do I keep my patient safe while I'm doing that task? I know how to evaluate if I can do the task, but how do I do the task safely? And that's everything on that back wall that we're going to learn. Everything on the back wall. Remember, these things aren't going to be on your care plans, but they are going to tell us how to. So one side tells us what to do. The other side tells us how to do it. Good? Good? Okay, and these are all the principles we're going to learn to keep us in our scope of practice. And then above all else, we have to remember that it's always about the patient. I have a saying, help isn't help if it doesn't help. Pretty easy saying, right? Help isn't help if it doesn't help. So let's say that you are broken down on the side of the road. Okay, you pull over, your car's smoking, you put the hood up, you have no idea what to do under there, but you're standing there looking all helpless and hoping somebody's going to come along and save you. And I drive up and I pull over because I'm a helpful sort of person. And I say, looks like you're having some trouble. And you say, yeah, it's smoking. I say, do you know what's wrong with it? And you say, no, I don't know what's wrong with it. Do you? And I look at it and I say, yeah, I think that we probably should put some pineapple juice in the radiator. I think that I've heard that that's a great solution for this. And I just left Publix. I got some pineapple juice. So let's put that in the radiator and see what happens. Well, that wasn't really help, because now I've taken a problem and made it into a really big problem. And you now need a brand new engine. By the way, don't put pineapple juice in your radiator. Okay. Was that help? Help isn't help if it doesn't help. Even though I looked helpful, I tried. I gave you an opinion that wasn't based in fact. I didn't know anything more than you did, but I sure looked like I did. Help isn't help if it doesn't help. And CNAs are guilty of this all the time. We get in there and try to help when we're not helping. The way to stop doing that is to remember that it's not about you. It's about the patient. It's always about the patient. So if the patient says, no, I don't want to shower, and you force them into the shower, you did not help them. That was not help. Make sense? Help if it isn't help if it doesn't help. And then the last thing that we have to remember to keep us in our scope of practice is that everything we know, the nurse needs to know. So if you're helping somebody into the shower and there's a red rash on their back, the nurse needs to know that. If you're feeding somebody and they're coughing, the nurse needs to know that. If the patient's supposed to get out of bed and they're too weak today, the nurse needs to know that. If the patient is usually up by 5 a.m. and it's now 8 o'clock and they're not really stirring, sure, they're probably just sleeping in, but the nurse needs to know that. Good. There's days I don't want to get up. I'm getting old, guys. There's days I don't want to get up. That's my right. I have gotten up on time my entire adult life and been responsible. When I get to retirement age, I'm going to sleep in. Leave me alone. But if it's a change from normal, the nurse needs to know it. Good? Make sense? So throughout your career, you're going to be faced with this dilemma. The nurse is going to ask you, hey, can you go do this for me? And you're going to come up with that answer. Am I allowed to do that? Is this something I can do? If I ask you, I want you to go take a catheter out of room 212, you're going to think to yourself, am I allowed to do that? Am I? And the answer to that is we have to go back to our scope of practice. Is this a routine task on a stable patient that you have been trained to do? And it's on the care plan. Now, care plans can be verbal. I can ask you, can you please go take the catheter out of room 212? Now, is this a routine task? Yeah, taking catheters out actually is a pretty routine task. Is this a stable patient? Probably, because I'm asking you to do it. But have I been trained? Oh, well, you haven't been trained to take a catheter out, so what would you tell me? No, I haven't been trained. Now, I can, as a nurse, take you into the room if the policy and procedure allows it and say, okay, let me show you how. It's really easy. You just take the water out of the balloon, it slides right out. Super easy. That's it. That's all you got to do. So it's a routine task. Patients getting ready to go home, so they're stable. You've now been trained, and I've asked you to do that. That's an assigned task. So yeah, once you've been trained, sure, that's something you can do. This is how you evaluate whether you can do something outside of what I'm training you to do in here. Now, the reason this is important is because throughout your career, you are going to work in different settings. The skills that I'm teaching you in here are what we call baseline skills. You're not going to use all of them in all settings. So there has to be a mechanism where we can train you for the skills that you're going to need in that setting. Good? So let's say that you go to work in the mother-baby unit. Okay? So you're going to have to learn how to swaddle babies. And it's not a hard skill, but we've got to train you so we can make them into little footballs so that they stop crying. It's a great skill to learn, right? So you would be trained to do swaddling. Now you go to work in a same-day surgery center discharge area. So our patients have come in, they had their surgery, they recovered, we're sending them home. It's the end of the day. That's your job. You are not going to need any swaddling techniques. That is just not even in your wheelhouse, not even relative at all. But you probably would need to know how to take a catheter out. Now, you're not going to be working with catheters. So do you see how each setting is going to require a different skill than what you're learning in here? Good. If somebody asks you to do something that you've never been trained to do, your answer is no, I have not had that training. But I would like, I'm open. I'm open. Good. Questions? All right. So page 14 is going to talk to you about delegation. This is the technical term. Every skill that shows up on a care plan has been delegated to you by the nurse. Every skill. So the nurse decides something needs to be done, puts it on the care plan, we're going to do that skill. That's called delegation. Now, in order for me as the nurse To delegate, there's 5 things that I have to look at to even find out whether it's a delegatable task. I'm not going to bore you with all of those details because that's something the nurse has to do. What I need you to understand is if something has been delegated to you, the nurse is taking the liability for it, and they've made sure that it is a delegatable task. Your responsibility is to deny that task if it is not routine, business as usual, if the patient is not stable, or if you have not been trained to do the task. If any one of those 3 apply, you decline the task. That is your responsibility. You tell the nurse, I can't do that. I haven't been trained. I can't do that. That patient is not stable. I can't do that. It's not a routine task. It's not something that I normally do. Good? Make sense? Those are the 3 times that a CNA can legally, morally, ethically decline a task. Good? All right. As long as you are in your scope of practice, remember that's our little happy place. As long as we are in our scope of practice, we have no liability. But let me talk to those of you who think that you're going to go home after class and type out a little thing on Craigslist or Facebook Marketplace or whatever. I'm a CNA and I will take care of your loved one in your home for X amount of dollars an hour. This is a growing trend. A lot of CNAs are doing this. It's called private care, where you're not going through an agency. You're just contracting with a family or a client independently. Now, it's fine. You're going to get a higher rate of pay by doing this. This is why a lot of CNAs are circumventing agencies. You get a higher rate of pay because there's no middleman. But there's some problems here. First of all, CNAs legally have to follow a care plan. Who's doing this care plan for you? The only people legally that can create a care plan is an RN. So who's creating the care plan for you? Nobody. So if something goes wrong, now you might work your entire career and have no problems at all. But if something goes wrong, and Morgan knock on your door, that's the first thing they're going to point out. Who gave you the authority to do this? And if you say, well, I've got a CNA, I'm certified, they're going to say, well, that's fine, but your scope of practice says you have to follow a care plan that is written by an RN. Who is the RN? And if you can't produce one, you are now liable for whatever happened to that patient. And you are probably going to be charged with operating outside of your scope of practice. So be careful if that's the path that you decide to go down. If you work for an agency, the agency is taking on that liability, right? That's their responsibility to put all that together. If you're operating privately, you get more money, but you also have a whole lot more risk. So just be aware of that, okay? We get private pay clients all the time that call us, all the time. You know, my dad has dementia. I'm looking for a caregiver. My mom is living with me. I need somebody 3 hours a day. I mean, we get all kinds of, and I usually refer them, you probably need to go through an agency because, you know, for individuals to do this privately is actually operates outside their scope of practice. All right. So we're going to talk about this and then we'll take our break. But the patient experience, I want to talk to you about this real quick because up to this point, we've kind of concentrated on CNA. It's what we're trying to become. The problem is that when we spend so much time concentrating on CNA, we kind of forget why we're here. We forget about the patient. And that's really what everything is all about, is the patient. I'm going to give you a tip for the test. When you go take the test, the evaluators are paying attention to the patient. They're not paying attention to you. And I know that sounds very counterintuitive, right? Well, why aren't they paying attention to me? I'm the one being tested, right? Aren't they watching what I'm doing? And our focus is on us, what I'm doing. That's not what this is all about. This is all about the patient. How does the patient look? How did you make the patient feel? Did you communicate with the patient? The patient, the patient, the patient, the patient. If you can make that switch in your mind, if you can start focusing everything on the patient rather than you and your steps and what you're doing, if you can take a step back and look at this person in the bed and see, are they in the middle of the bed? Is the bed in the low position? Do they look comfortable? Does everything look okay with? If you can start reframing your focus on them, that test becomes super easy because you would never do anything that puts them in jeopardy that causes you to fail. So like if this patient is really close to the edge of the bed, if you're focusing on your steps, you probably didn't even notice. But if you're focusing on the patient and you see they're really close to the edge of the bed, you'll fix that because you wouldn't want to be on the edge of the bed either. Do you guys understand shifting your focus a little bit? If you can manage to do that in the next 4 weeks, that test becomes super easy because now you're focusing on the same things the evaluators are. Okay. But while we're talking about the patients, we kind of have to think about their mindset, not just their physical space, but their emotional space. So I like to take just a moment to talk about this on page 21, the patient experience. And I want you to think back to the last time you were sick. So think back to the last time you were sick. And I'm not talking about a little cold, some sniffles. I'm talking about laying on the couch. Everybody leave me alone sick. Okay. What is your mood like when you're sick?
I'm really irritable.
Yeah, grumpy, grouchy, irritable. Yeah, give me what I want and go away, but rub my back. But go away, right? We're grumpy, we're grouchy. We want to be coddled and left alone at the same time, right? That's like horribly conflicting. But we're also very self-absorbed. I don't care whether you have something to eat. Go find something, go make something, go order something. Don't bother me. I am not getting up and cooking. Don't you see I'm sick? We're self-absorbed. And we're supposed to be. We're sick. This is the one time you can get away with it, right? So we're grumpy, we're grouchy, we're self-absorbed. But we're also thinking about what this illness means. Okay. Is this going to keep me from going to work? How am I going to pay my bills? If I'm in the hospital, who's feeding my cat? What is my significant other doing? Is my job still going to be there? Am I going to be able to work my job once I get out of here? Right? So there's a lot going on in our heads, not just the fact that we're sick. We are self-absorbed, but we're also worrying. Now, anybody in a facility, in a hospital or a nursing home, they'll tell you that they're dying. Just ask them. Everybody in a facility thinks they're dying. Because if you're sick enough to be in a facility, that means that you are sick. You can't just call up your local hospital and say, hey, I need a break. Can I reserve a room for 3 days, please? You can't do that. How do most people get into the hospital? What department do they have to go through? How many guys have ever been to the emergency room? Okay. The emergency department, their whole job is to get you discharged, to get you out, not to let you in. That is not their job. Their job is not admissions. Their job is discharges. Get you stable, get you home. Go follow up with your primary care. How many guys have ever heard that? Yep. That means that if you go into the ER, which 99% of all admissions are through the ER, you go into the ER, their job is to not let you in. It's to tell you you're fine and go home. So if you get admitted past the ER, that means you are sick. You are really sick. You are the sickest people in the community. We actually made you prove that you were sick enough to get this bed. We didn't take your word for it. We did tests to make sure that you deserve to be here. Your patient knows that they are the sickest people in the community. They automatically think they're dying. You think their stress level is low? Their stress level is sky high. What do you think it's going to do to their sleep? Do you sleep well when you're worried? How many guys have ever been a patient at a hospital, like stayed overnight? You know the worst place in the world to try to get some rest? In a facility. We have the lights on all the time. We have people going up and down the hallways day and night. We got people coming in the rooms about every 20 to 40 minutes on purpose. Because if it's not the CNA, it's the nurse. If it's not the nurse, it's the x-ray tech. If it's not the x-ray tech, it's the phlebotomist. If it's not the phlebotomist, it's the billing person. If it's not the billing person, it's the volunteer bringing the flowers. If it's not the volunteer bringing the flowers, it's the dietary person to get your order for the next day. If it's not the dietary person, it's the doctor. 20 to 40 minutes. You aren't getting any sleep in there. Now, what kind of mood are you in when you're sleep deprived? Oh my gosh, you think you were grumpy and grouchy before. Let's add this in there. You are not seeing your patient on their best day. You are seeing your patient on their worst day. If you expect them to be nice, you took a wrong turn somewhere. This is not a recipe for nice. This is a recipe for, I'm going to throw something at the next person that walks in that door. So if you've got a nice patient, that's a bonus. That's awesome. You are having an awesome day. Bask in it, because that's not reality. That's not normal. So don't ever say something like, well, she started it. It's not what we're here for. We are here to give them a little bit of sunshine that they desperately need, because they are under a black cloud. Do you guys understand your role here? Nice, even when they're not. Sick people have a right to act sick. And we have to recognize that, expect that, and act in spite of that. Good? Does that make sense? Never forget the mindset that your patient is probably operating under. We also have to be aware that every patient is different. You might have 10 diabetic patients, but that doesn't mean that we're going to treat all 10 diabetic patients exactly the same, because they are individuals. So looking around here, I have probably, 10 of you that have brown hair, right? So the majority of people in this class have brown hair. Does that mean that I should treat everybody with brown hair exactly the same? No. You guys are all different. You have different personalities. You have different learning styles. You have different outlooks. You have different career goals. You have different health issues. You have different body types. You guys are all individuals. You just happen to have this one thing in common. We have to remember that with our patients too. Okay? So just because somebody has a broken hip doesn't mean that they're going to have the exact same care plan as everybody else with a broken hip. Make sense? Good. All right, so we're going to go ahead and take our break. We're going to put 15 minutes on the clock here. Let me just write down where I'm at here. I'm at 29. All right, so on break, there we go. We have 15 minutes on the clock. You can use the restroom, grab some coffee. There's some sodas and water in the refrigerator. There's snacks available for you. And we'll see you back here in 15 minutes. In preparation. Okay. Oh, I need to steal the chair. Okay. And we're back. Any questions on what we've gone over so far? Any questions? Am I going too fast for anybody? Am I going too slow? All right. So let's talk about the test, since that is up front and center on your mind, I'm sure. After the class, you guys have to take a state certification exam. Our testing vendor here in Florida is Prometric, and they do testing for about 13 states. The thing about Prometric is they're the same across every single state. So if you're testing in New York, you're testing with Prometric, it's the exact same as in Florida. This made deciphering the testing standards much easier. There's other states that use different testing agencies, and all of them are different. It becomes very complex. Prometric is easy. It's standardized. That means that everything that I'm going to tell you about the test is open knowledge. It's published either on their website or through other means. So there's nothing hidden about Florida testing, but you have to know where to look. So I'm going to explain to you the whole process. You've got notes on page 12 about the test. But there's two parts to the exam. There's a written test we're going to talk about in just a few minutes. And then there's the clinical test. And the clinical test is by far the hardest. The written test, you guys probably have enough information right now to pass the written. Remember, we follow the care plan. But the clinical test is a little bit harder because you actually have to physically perform 3 skills in front of some evaluators who are going to be judging you. And that's really, really high on the stress meter. Nobody likes to be watched doing anything, right? That's just human nature. We don't want to be judged. And this is all about being judged. So, you know, your anxiety is sky high just because it's a test. And then when we start to think about all of the steps that we have to do for each one of these skills, it becomes a little overwhelming. My job is to simplify this, to make it easy for you so that that stress gets diminished and you perform well during testing. Okay? So if I do my job right, testing day should not be stressful for you. So on testing day, our closest testing center to us here is in Tampa. If you're in Citrus County, there is one in Ocala. So you don't have to go to Tampa. It just depends on which one you're closest to. Tampa actually has 3 testing centers that you can choose from, but I'm going to talk to you about the one that's closest to us. If you go down the Parkway, it's this side of the airport. So it's not too far, maybe 35 minutes or so. When you go to the testing center, and we're going to talk about the process, the registration process and getting your test date later. But when you go to the testing center, you are going to be there with 7 strangers. You are not testing with the people in this classroom. Everybody is going to be registering independently, and it depends on how long it takes them to process your application and then assign you a test date. So you won't be testing with your classmates. You'll be there with 7 strangers. When you go to the testing center on testing day, you can't take any study material or electronics into the testing center. So there's nothing to do. I mean, you don't have your phone, you don't have a tablet, you don't have flashcards you can study. You're sitting there literally staring at 7 strangers. It's uncomfortable. But you can keep your study material out in the car. You can keep your phone out in the car. So when you first go in, the only things that you can take in with you is your test admission letter if you printed it. You don't have to print it, but if you have it, you can take it in with you. Your keys and 2 forms of ID. Now, one of those IDs has to be a non-expired government-issued photo ID. So think driver's license, ID card, passport. Military ID, I also think they'll take. Other than that, that's it. And it has to be non-expired. We had a student about 6 or 8 months ago that contacted me crying in tears at the testing center. She said they won't let me test because my driver's license is expired, and I didn't realize it. So please make sure you take a minute to check your driver's license and make sure it's not expired. Sometimes those things kind of get away from us, but they don't give refunds. So she is out $155. It's sad. Take a minute to look at your ID sometime between now and testing and make sure you're good. Okay. Second ID just has to have a signature. So a debit or credit card, social security card, library card, right? Anything with a signature, but the name on that ID has to match the name on your photo ID. Just make sure those names match. And this is problematic for those of you who have more than 3 names. So if you have a first name, a middle name, and a last name, that's usually pretty easy. But if you have 2 middle names, this can get a little complex. So make sure that, or if you have 2 last names that may or may not be hyphenated, make sure that both of those IDs have all of the same names on them. Okay, good, good. So when you go into the testing center, they are going to check you in. So the evaluators are going to bring you in and they're going to ask you your name. They'll look at your IDs. They look at their form. They make sure that you are you and you're not testing for your sister, cousin, whoever. Once they get you checked in, they're going to ask you, do you have any conditions that would keep you from being a patient for any one of these skills? And you're going to tell them, yeah, I've just had mouth surgery. I got some stitches, or I've got athlete's foot, or I got a cast because I have a broken arm, whatever the case may be. Just tell them any limitations that you have. Ideally, you have no limitations. That's ideal. That's what we want. But if you have some, make sure you let them know. And then they're going to put you into a waiting room. And they're going to check in the next person and the next person and the next person. Once everybody's checked in and sitting in this waiting room, staring at each other because you have nothing else to look at, those evaluators are going to disappear. Now, in Florida, we have 2 RN evaluators that are going to grade you. Times being what they are, we don't always have 2 that show up to testing. So sometimes there will be 1, but there's supposed to be 2. Those evaluators, once they get everybody checked in, disappear for 20 to 30 minutes. And you're going to be sitting in that room wondering what they're doing. Let's get this started. Let's move on. And they're going to be nowhere to be found. What they're doing is pairing you up. And this is not random at all. Not random at all. So you're there with 7 strangers, and their job is to pair you up based on the skills that each of you have. So if you have transferring somebody from bed to wheelchair, they are going to try to put you with somebody your body size or smaller. So they're not going to take somebody like you and pair you up with somebody like me. Okay. They want to try to find somebody your body size or smaller, somewhere in that general range, to try to make this easier. And the reason for that is because the skill standards are what they call minimum skill competency. You are not there at the test to prove that you are a master CNA and there's nobody better. It's not the Olympics. We are there to prove that we have just enough skills to allow us to get into the industry without killing somebody. Minimum. So if you're thinking up here, lower your expectations. Don't be afraid to go too low. They're not going to try to trick you. Every scenario is set up to be the easiest possible scenario for that skill. Does that make sense? They're not trying to make it hard. So all of those nightmares that you have, right? That, oh my gosh, they're going to fail me. They're going to try to fail me. They're going to trick me. None of that applies. None of that applies. So let me tell you a little bit about the history of the test, because I think it gives you a really good understanding of why we test the way we do now. Back before 96, way before 96, in order to be a CNA, you just had to go to work somewhere. They trained you, and the director of nurses would walk down the hall every so often and stick their heads into rooms and watch you do part of a skill on a patient. So you got hired, you got trained on the job training, and then the nursing home administrator or the director of nurses would just kind of spot check you. And after a while, once they were satisfied, they would write a letter to the board of nursing to say, this person has the skills necessary to be a CNA. And then the state board would go, okay, cool. You are now a CNA. Congratulations. That was it. That was testing. So it was on the job training with minimal oversight. And somebody somewhere just said, yeah, you're good. Well, there was some problems with that system. First of all, once you were certified, they had to pay you more. So that director of nursing wasn't in a hurry to certify you, because then they have to pay you, right? So they would put it off and put it off and put it off. And now you're working like a CNA, but you're not getting paid like a CNA. So there's a problem there. There was also a problem with, how do I put this? Personality conflicts. Let's say that one day you accidentally parked in the DON's parking spot. It's the one she's been using for years, and you are in her spot today. Well, that could kind of put you guys off on the wrong foot, and now she's probably not going to certify you because, she's mad at you. Or you called in because you were super sick and she couldn't find somebody to replace you. Now she's not going to certify you, right? There's a power imbalance there, isn't there? So they had to come up with another system. So in 1996, something called OBRA happened. It was a law that was passed. And instead of the DON being responsible for training and testing, and it wasn't a unified test, it was just, look in the doorway occasionally. They created testing standards, and they said, okay, we want an independent person to come in and check all these people off on a pretty regular basis. So like they can hire you and they can train you for 6 months, but at the end of 6 months, somebody's got to make sure you've got the skills. So they had these roving evaluators that would just kind of go on this circuit, and about every 6 months they'd go into the facility and check off anybody that was trained during that time frame. And if you got checked off using some standardized steps, then you were a CNA. And they wrote a letter to the board of nursing, said, hey, these people are CNAs. Well, then they developed what's called the registry. So the registry is, we want one single list of all CNAs, because if you are working at ABC nursing home and you, I don't know, do something really boneheaded, like make the dementia patients participate in a fight club, which was something that actually happened, yes. We probably don't want you working with dementia patients anymore. You're not a good fit, right? So we're going to put you on a list. That way, when nursing home ABC wants to hire you, they can see what happened at 123 nursing home, and they're less likely to hire you. Make sense? Good. So that is the registry. That registry is what set up what we have now. So once we had to have a registry, now we have to have a recognized, repeatable way of getting you on the registry with verified testing processes that are uniform. Everybody goes through the same process and keeps track of not just where you work, but any complaints against you. That's what the registry is. So Prometric is who the Board of Nursing in Florida said, hey, we don't want to do all this, right? That's a lot of work for us. We'll keep the list, but we want somebody else to do the testing. It's just a lot of hassle. So they hired Prometric to do the testing. Now, Board of Nursing does the list, but Prometric does the testing. So the two have to work together. Does that make sense? Two have to work together. This is going to be important in class 4. We're going to go over the testing process. I'll be talking a little bit more about this, how these two have to work together to generate you a test date. So we're going to talk about that a little bit more. But understand there's two forces here. Board of Nursing, who sets the standards, Prometric, who does the testing. So when you go to the test and they check you in and you're sitting there waiting, what they're doing is partnering you up with two, in groups of two, to make it easy for you to test. That makes sense? Minimum skills competency. They're not trying to make this the hard way. So one of the things that they're going to look at is your shoes. Now, when you go test, you can wear anything you want. Anything. You can wear a clown suit. You can wear a bikini. You can wear anything you want to test, except you have to have closed-toed shoes on. They don't have to be tied shoes, but they do have to cover the foot. So unfortunately, Crocs even satisfy that, but you need some sort of closed-toed shoe. So don't go in sandals. Don't go in high heels. But if you, let's say, I'm just going to pick on you. Let's say that you have ambulate with a gait belt. Okay, so I'm going to look around. I'm going to find somebody that's about your body size, close to. And as I'm looking around, I'm actually looking at shoes as well. And it looks like, do your shoes do you just slide in or do you tie them? You tie them? Anybody here have shoes they just slide in? Anybody? Okay. Even though you have shoes that just slide in, you don't meet her body size or smaller. So I'm going to keep looking. Anybody else have shoes just slide in? Okay. Unfortunately, you're going to have to tie shoes. But before I make that decision, I'm looking around for somebody to make this easier. Because if I can find somebody her body size or smaller that we just slide our feet in, it makes it easier to do the skill. Do you guys understand that? So during the test, you can wear tied shoes. That's fine. No problem. You don't have to go out and buy new shoes. But if you wear shoes that you just slide your foot into, you probably will increase your opportunity of being picked as a patient for mobility skills. So things like ambulate, transfer from bed to wheelchair, or even foot care. Okay. Does that make sense? Everybody good with that? Okay. So they've divided you up into groups of 2. When they have you into groups of 2, they're going to give you, how do I put this? Group numbers. So you guys are group 1. Don't go anywhere. You're going to be tested first. Stay tuned. You guys are group 2. You're going to go into the waiting room if you want to. You can go to your car and study. You can go get a cup of coffee, but you need to be back here in this room in about 45 minutes. Okay. You guys are group 3. You've got about an hour and a half to kill. So target clearance shopping, get your mind off the test. You'll do much better. Just be back here in about an hour and a half. You guys are group 4. You don't need to be back here for about 2.5 hours. So 2 for 1 margaritas at Chili's. We'll see you later. All right. You guys are group 1. Notice you did not have to stay in the waiting room. We gave you a time to come back. That's why you want your study material out in the car. So you guys are group 1. We're going to bring you into the testing center. Now, if this were a testing center, there would be a wall around this area. Okay. So all of you guys out in the waiting room, you can't see what's happening in here. You can't hear what's happening in here. This is a totally separate room. And there would be a door coming into the room. There's a supply shelf in the room. There's a 3-drawer cabinet in the room. There's an overbed table. There's a patient and a bed in the room. Most skills are going to be done on live people, but there are a few that are done on mannequins. Okay. But we have to show you around because you have no idea where the washcloths are. You've never been here before. We got to show you around. We're going to show you what we use excuse me, as a privacy curtain here. We're going to show you where our bathroom area is. We're going to orient you. Once we're done orienting you to your environment, then we're going to pick one of you to go first. I'll just pick on you because you're closest. And the computer is the one that chooses your skill set. The computer does that, not the evaluators. Now, this is to help prevent bias, because if the evaluator doesn't like you for whatever reason, you can say, well, she gave me the hardest skills there are. No, the computer picked it. The evaluator did not. Now, something you need to know about those evaluators is they don't want to be there. They don't. These are people who have worked in a clinical setting. They have to have a certain amount of experience to be an evaluator. And when you are done with your test, when everybody leaves, they get to go home. They don't punch a time clock. They're not there like from 7 a.m. until 7 p.m., you know, like if they were working in a hospital. They are only there while people are testing. So the sooner they can get you done and out, the sooner they can get home. They don't want to be there. They want to be home in their pool drinking their margaritas. And you need to understand that, because if you're taking forever and a day to do your test, where do they want to be? At home, in their pools, drinking their margarita. And who's standing in their way? You are. That's right. So you need to have a certain level of competence. You need to go in. You've got to have some confidence behind you. You need to do your skills, and you need to get done. Make sense? They're not looking for perfect. They're looking for, if I say that you are okay to be a CNA, are you going to be killing people? I mean, that's what their mindset is. Is this person safe for me to release into the public? Is this person doing things that could actively endanger a patient? Those are the things that they're thinking. They're not thinking like, oh my gosh, she folded the washcloth wrong. Who cares? That makes no difference to anybody. That's not going to kill a patient. They're looking at big picture. You, because your students are focused on micro points that don't matter to anything. Okay, so widen your view a little bit. Good, makes sense? Okay, all right. So the computer picked your skill set. So give me a number 1 to 11. 8. All right, so the computer picked skill set 8 for you to perform. And your skills are feed the resident who's in a chair, perform passive range of motion to elbow and wrist, and assist a resident needing to use a bedpan. Now, they're going to read this to you. We can't even trust that you know how to read, guys. The evaluators read this to you. And they don't just read it to you. After they're done reading it, they're actually going to give it to you. Here you go. Those are your skills. Now, you can read it. You can put it somewhere that's easily visible and go back and review it anytime you want to. Because remember, we're graded on following the care plan. So if you get halfway through a skill and you can't remember what the care plan said, you can tell the patient, hold 1 second, I'll be right back. And you can come over here and you can read the care plan again. Perfectly okay, because we're graded on following the care plan. So you can read that anytime you want to. Good? Now, as you are performing those skills, those evaluators are going to check off your steps. And we're going to get to that in just a minute. But you need somebody to perform those skills on. Now, you're sitting around with nothing to do while you're waiting. So you're going to become the patient for her while she's performing her skills. Once she does all 3 of those skills, and they have to be done in the order listed. You can't change them up, in the order listed. So you're going to do those 3 skills on her. Once she's done, you're going to get your very own care plan, probably a different one. And you're going to perform your skills on her. Now, there are a few skills we're going to do on a mannequin. I'll get to that in just a few minutes. But when you are the patient, you're going to get a script. They're going to tell you what to say and how to act. And it's important that you are you, not a 90-year-old version of you. You're not there to win an Academy Award. If ambulate is something you have to do, if you're going to walk the patient's going to walk like they walk. Right? They're not going to do something like this. Okay? You're going to be you. If somebody is feeding you, you're going to eat like you eat. You're going to chew and swallow. Good? Make sense? Don't overact this. You are you. But you're also going to get told what to do. You're going to be pleasant and cooperative, right? All the patients we don't get. Pleasant and cooperative. So how many of you guys have a live person at home you're going to be practicing skills on? Your homework today is to go home and tell your live person at home, the teacher said that when I'm practicing skills on you, you have to be pleasant and cooperative. The word no is not in your vocabulary. Because if they're, and the people at home, bless them, but they have no clue. They'll say things like, oh, well, not all your patients are we're getting you ready for the real world. No, the real world, all of those things they're trying to do to you has no bearing on the test. They are trying to satisfy their own needs, not yours. If they want to be a help to you, they're going to help you get ready for the test. And for the test, your patient is pleasant and cooperative. Good? Makes sense? Because the people at home, they will try to derail you. They will. I don't know why, but they will. Don't let them. So that's your homework for tonight. You go home and you tell your family, don't do that. Just do what I tell you to do. Okay? And that'll help you get ready for the test. So you have your 3 skills you're going to do on her. She's got a script. She's going to be pleasant, cooperative. She's going to do what you need her to do. You're going to get done with your skills. She'll get her care plan, different care plan. You'll do your skills on her, and then you guys go out to the waiting room. You got about 2 hours to chill. Nothing to do. Don't go. I mean, you can go somewhere, but you got to be back in about 2 hours. You guys, you're going to come in. Same thing. I'm going to show you around. I'm going to pick you to go first. You'll do your skills on her. She'll do her skills on you. You go back out to the waiting room. You guys will come in, same thing. You'll do your skills. You'll do your skills back out to the waiting room. You guys stumble in from Chili's. You'll do your skills. She'll do hers back out to the waiting room. When all of you guys are done with the skills, then we're going to go into a different room that has computers, and we're going to take a 60-question multiple choice exam on the computer. And I haven't been advancing my slides, so bear with me. So the evaluator gives you your care plan. Your other person becomes your patient. You'll have that care plan throughout the test to be able to refer back to it. Remember the yellow care plans have the testing checkpoints on the back as well. So let me explain to you how this is going to be graded. So we have the checkpoints on the back. Page 65 is going to talk to you about skills grading. But when you're taking the test, as the evaluator is watching you perform the steps, they're going to be checking off things as long as they are complete. So let's say that we have a line that has a couple of things on it. If you don't get all of those things, you don't get credit. So the line has to be complete. So this one doesn't have this, but I'll show you one in a little while that does. But as you're going through your steps, we're going to learn the opening in a minute, but you're going to, good morning, Ms. Jones. My name is Patty. I'm your CNA today, and I'm here to take your pulse. Is that okay? I'm going to close curtain, wash my hands. I'll be right back. When I find the radial pulse located at the wrist, but I did not hold the resident's arm in a manner to avoid it dangling. So I just pulled her arm off the bed like this, right? So this checkpoint is not met. I took the pulse for 1 full minute like I was supposed to. And then I did my closing. Thank you very much, Ms. Jones. Is there anything else I can get for you while I'm here? Are you comfortable? Would you like a magazine before I go? Bed's in the low position. Environment's clean. Here's your call light. Open the curtain. Go wash my hands. And now I tell the evaluator, my skill is done. So that skill is done. I can't go back and do anything about that skill. It's done. I have closed it. I was in control of that. But I did not write down the number. If I count something and it's in my head, does that help the nurse? No. So failure to document is failure to do the skill. Because the whole reason for counting is to get that information to the nurse who needs it to do something with it. So I did not support the resident's arm and I did not document this skill. So those two things did not get check marks. Anything without a check mark is called a deficiency. This is what is put into the computer to determine your score. Now, not all deficiencies are going to count equally. Let's talk about mouth care. Let's say that we're going to brush this person's teeth. Are they in a safe position to have their teeth brushed? Why? Okay, they're laying down. What could happen to them? They could choke. The technical term there is aspiration. They could aspirate. So what would I need to do to get them in a safe position for mouth care? Okay, so yeah, I could sit them up somehow, right? So either they're sitting on the side of the bed, get them to the bathrooms, put the head of the bed up. I got to do something. I can't brush their teeth with them laying flat. Sound good? Okay. Care plan would give me some information on what step to use to get them in an upright position if there's any limitations there. So if I'm going to brush their teeth, let's think about how you brush teeth for a second, right? When you brush your teeth, are you sitting like this when you brush your teeth? When you brush your teeth, you're usually leaning forward over the sink. Why is that? Yeah, we want all of that drippy, gooey, foamy mess to go in the sink, not on us. So we lean forward. Well, if I put the head of the bed up, your patient's not really leaning forward. They're just upright. Safe for brushing teeth, but they're still going to get stuff all over them. So what could I put over their clothing to maybe protect it? A towel. Sure. Anything will work there. Just something to soak up the foamy mess. So if we're brushing somebody's teeth in bed, putting their head up and towel are both necessary steps. But has anybody ever died from not using a towel on their chest? No. Do you think anybody's ever died from aspirating toothpaste? Probably. So those two steps are not equal. Do you guys see that? Putting the head of the bed up, way more important than putting a towel on the chest. Each step that you see, let me go back one, each step has a weight associated with it, and they're not all equal. So the question I get asked a lot is, how many steps can I miss and still pass? And the answer is, well, it depends. Which steps did you miss? Because if you missed putting the head of the bed up, no, you're not going to pass because you just killed your patient. If you miss putting a towel on the chest, well, yeah, your patient's wearing toothpaste, but they're not dead. So that's, do you guys understand that each step is weighted? And there's no way of saying, well, you can miss 2 things on this skill and pass, because it depends on which 2 things you've missed. Well, let me ask you this. How many of you guys have ever been to a doctor? What kind of doctor do you want when you go to a doctor? What kind of what's a qualification you would want in a doctor? Patience, that's a good one. What else? Kind, I like that. There it is. Competent. Yeah, I want a doctor that knows what they're doing. Okay, communication and direction. So let me ask you this. If you went to a doctor that's patient and kind and has clear communication, but they only diagnose right about 10% of the time, is that the doctor you want to go to? No, you want somebody that really knows what they're doing, right? Somebody who's probably more in the 90 to 99% of getting it right. Make sense? All right. So I'm going to turn this around on you. What kind of a CNA do you think your patient wants? Somebody that got most of the stuff, or somebody that knows how to do the skills competently? Your patients are putting a lot of trust in you. And the answer to how many steps can I miss and still pass is none. Because if you're the body in the bed, you don't want somebody taking care of you that missed steps either. So I want you to practice these skills until you're not missing anything. Because it's not about you passing the test. It's about the type of service that you're providing another human. How many steps do you think they're comfortable with you missing?
0.
Does that make sense? Okay. I know that right now you are hyper-focused on your performance on the test. I have 4 weeks to change your focus, because it's not about you. The test is not about you. Good. I'm getting older. I'm going to be the body in the bed. Everybody will be the body in the bed eventually. What kind of care do you want when it's your turn? That's why I do this. I am trying to create an army of caregivers that's going to give me good care, because I've seen some of the CNAs out there, and I don't want them taking care of me. So you have a choice. You get to decide what kind of CNA you want to be, and you will use that to spur your studying. You will either study just enough to get by and barely pass the test, or you will use it to spur you to study to be competent. That's completely up to you. Okay? So I challenge you to think about the type of CNA you want to be when you're studying. All right, so once we're done with our skills, we're going to go into a test room and do a written test on a computer. 60 questions. You have 90 minutes. They're all multiple choice, and none of them are hard. None of them are hard. These are not trick questions. Now, on your syllabus, we're going to get to the syllabus in just a few minutes, but down here at the very bottom, the very last one, the very last QR code here, it says game show playlist. You guys see that? I do a game show on YouTube twice a month. The first and third Tuesday of every month. So last Tuesday I did one. I'm not doing one tomorrow, but I will do one in next week for that you guys can all participate in. This is live on YouTube, so you have to go to YouTube. So if you click on that, you can see the replays of previous ones. But if you go to YouTube, just my YouTube channel, which is the second QR code there, at 11 o'clock on Tuesday, and I'll remind you, I do 15 test-like questions, and you guys compete for real prizes. And I have people from all over the world that compete in this game show. You compete for real prizes. So first place is a t-shirt, second place is the card game, third place is some motivational gifts. And when you're on YouTube, I read you the question and the answer choices, and you put into YouTube 1, 2, 3, or 4 based on like a multiple choice exam. These questions are written in the same way as the written test questions. So if you kind of want to know what to expect for the written test, go to that playlist and watch some of my previous ones. And it'll give you a really good understanding of the type of questions they're going to ask. But one of the things that I do when I give you the answer is I go over why it's the right answer. But when I write these questions, guys, you have to understand that question writing is very scientific. There's an art and a science to it. They don't just throw a whole bunch of words together and hope for the best. These words are positioned strategically to lead you in a specific direction. And the answer choices are too. So like the first answer may be misleading on purpose. To truly understand, do you understand the topic? And that's how I write the questions. So I explain all of that. You can learn a lot about test taking strategies by watching the replays of the previous ones. Okay. So if you're not a good test taker, I would spend some time with that. If you're a good test taker, just watch it for the content. Make sense? I also have a free ebook to help some of you that, especially if you're not a good test taker. This is a download. Just go to this website. It's on your the blue paper, the first day paper. I've got a QR code on there, I think, for the ebook. I think. It'll also be in the wrap-up email as well. Is the ebook on there? Okay, yeah. It helps explain how the written test is developed and the categories of questions you're going to see. This is the game show I was talking to you about. That's a QR code that's on here for you. During the game show, this is what it looks like on the screen. You'll see the question, the answer choices. Once I expose the right answer, it's highlighted, and then I explain why. But you can win some prizes. All right, so once you have taken both parts of the exam, you're going to get some results. And the results look like this. Get the right one here. This is the results for the written tests. All of these are up here. This is to be able to look at. Everything on this shelf is accessible to you. So this is the results from the written test. This is what it looks like. And it's going to tell you the 5 categories of questions, how many questions were in each category, and how many you got right. And again, the question I get asked, how many can I miss? And the answer is, well, it depends. What did you miss? Because some of these questions are going to count big. But it's even more scientific than that. And there are 1, sometimes 2 questions on the state exam that if you choose the wrong answer, it's an automatic fail. That one question will fail you. These are life safety questions. They're always emergency questions. So the question, they're called critical concept questions. And the question would be like, this is the scenario, whatever, you walk into a patient's room and there's a fire in a trash can. What is your first action? And there's 4 choices there. Well, one of them is right, obviously, and 3 of them are wrong. But one of those wrong answers, if you do it, you put your patient in immediate jeopardy. If you're putting your patient in immediate jeopardy, do we want you to be a CNA? No. That's not a learning opportunity. That's a you're going to kill a patient opportunity. So there's 1, sometimes 2 critical concept questions on state exams that if you choose the wrong answer that puts your patient in jeopardy, it's an automatic fail. So my job is to make sure that doesn't happen. Okay. And we'll get to that as we go through. Are we good? Everybody good? All right. You'll also get a printout for the skills test results. And that looks like this. This is your results for your skills. Down at the bottom here, it'll list the skills that you had for your test. And then you're going to get a feedback sheet that looks like this. That's what is here. That feedback is everything on your test that wasn't checked off. All of those deficiencies. Remember the deficiencies? They're all going to be listed for you here. Please make sure that you read this when you get it. If you don't get this page, and most of my students don't, if you don't get this page, it means you didn't miss anything on the state exam. Most of my students don't get this page. That's good. That means that you are now qualified to take care of me. Okay. But if you do get this page, please take a moment to review it, to figure out what you missed on the state exam. That way you'll pay attention to that when you're working with real people. Okay, good. My favorite part of the exam is this. If you make a mistake, you are able to correct it. You're able to correct it up until the point that you end the skill. So, you know, when you're watching a game show and they hit that buzzer and it's like final answer, right? You can't change it. That's what this is. So you're going to go through your skill. You're going to, good morning, Miss Jones. My name is Patty. I'm your CNA today. I'm here to whatever. Is that okay? Close curtain, wash hands, do skill. The end of the skill, thank you very much, Miss Jones. Is there anything else I can get for you while I'm here? Here's your call light. Would you like a magazine before I go? Bed's in the low position. Environment's clean. Open curtain, wash hands. Document if necessary, wash hands. Again, we're going to get to all that in just a minute. I get done with my skill. I'm going to go over there and read that care plan one more time before I end my skill and just make sure that it didn't tell me to stand on one foot or pat my head or do something crazy that I missed. I'm going to read that care plan. Once I'm done reading that care plan and happy with my performance, then I'm going to tell the evaluator my skill is done. Then I can move on to skill 2, which is perform range of motion on the elbow and wrist. Okay. So then I would go on to skill 2. I'd finish that skill up and say my skill is done before moving on to skill 3, assist with a bedpan. You are in control of how long these skills take. Nobody's rushing you. But you do only have a certain amount of time to do your skill set. And can you hand that to me real quick? And, thank you. At the bottom of this, down here, you're going to see the amount of time that the test gives you to do this set of skills. Good? Questions? Okay, you can pass this around if you'd like. That way everybody can see it. So you can make a correction, and it's as easy as saying, correction, I would have whatever. Correction, I wouldn't have let the arm dangle off the bed. I would have supported it. Correction, I would have closed the privacy curtain. I forgot. Correction, I would have made sure the patient was covered. I wouldn't have exposed them. You can make corrections. If it's something they need to see you do, they're going to tell you, we need to see that. Good? So page 33 talks to you all about corrections, but it's just as easy as correction, I would have.
Now, if you're doing a correction, does it still count against you?
No. Now, here's the thing. Remember that checklist that you have, right? Everything you do gets a check mark. Everything you don't do, no check mark. So when you correct something, you get a check mark, and that paper doesn't know whether you did it or corrected it. It's the same check mark. So take the minute to think about your skill before you end it. Don't be in a hurry. I know those evaluators want to be at home in their pool drinking their margaritas. They can hang out for just a few minutes while you make your corrections. What they don't want to see is you starting the skill over and over and over and over and over again. And yeah, you can start your skills over. You can, but this is where that competence comes in. If you've practiced your skills, by the time you get to the test, you shouldn't need to start them over 5 times to get it right. Good? All right. So if the evaluator needs to see you do the step, like I can't say, correction, I would have taken the pulse. No, we need to, that's like the whole skill. We need to see you do that. But I can say, correction, I wouldn't have let the arm hang off the bed. I would have supported the elbow. All right. Read the care plan before you end your skill, just to make sure there's nothing on there that you forgot to be done. Most corrections are usually in the form of order, like, correction, I would have closed the curtain before I washed my hands. We're going to talk about why in just a minute. But it usually has to do with the order of things, and they don't make you go back and redo that. All right, so let's talk about our books. So in front of you, you have your syllabus, the skills book, and your homework book. All of this is based on our website, foryourcna.com. This is what we call our free site. I'm going to be talking to you about a couple sites that I have, but the free site is foryourcna.com. That's where all of my stuff is free. Skills videos, animated lessons, test registration instructions, local employers. I got a ton of stuff on this website. It's all free for you. So just remember that website. This is the homework book. You're not going to write in it, but you are going to read it for homework. So if you look on your syllabus here, in the third column, you'll see homework. This syllabus, as we go across each section, is by day. So like this section is Monday, that's today. All of this stuff we are going to do today. The first column are the skills that we're going to do in class. So if you look at that, you can see that we're going to learn skill rules. Well, we already did. Remember, we followed the care plan, the whole care plan, and nothing but the care plan. We're going to learn the opening. We still have to do that. The closing, we still have to do that. Hand washing, we still have to do that. And indirect care. So we still have a long way to go, and I only have an hour and 15 minutes left. The second column are lectures that I'm going to give you in that class related to those skills. Now, we've already done most of this. We talked about the exam, so we can check that off. We talked about delegation and liability, so we can check that off. Talked about patient considerations. What are our patients going to be like? We can check that off. We talked about the testing care plans. We can check that off. That's what we just passed around, the yellow ones. And we talked about the principles on the back wall, so we can check that off. So even though we still have skills to do, we've gotten quite a long way in our learning today. Now, the third column there is homework. That's what you are going to do between classes. So between now and Wednesday, you are going to have to read chapter 1 in that yellow book. It's written at a 6th grade level. The writing is big. There's lots of pictures. It's not hard, but it is a little time consuming, and boy, is it boring, because it is a textbook. So those of you who have attention problems, if you've ever looked at a page and read something and realized that your eyes are reading the words, but your brain is not there, it didn't sink in, A study tip for you is to study in small blocks. Don't sit down and try to read all of chapter 1. You're not going to retain any of it. Read for 5 or 10 minutes and then go do something else. Wash dishes, walk the dog, play with the kids, fold laundry. Do something that is physically active, but not mentally draining. Don't watch TV. Don't scroll on TikTok, Facebook, whatever your social media of the day is. Instagram, Snapchat. I'm not good at social media. Go do something that is physically active, but not mentally engaging. Make sense? What that does is it allows your brain to digest what you just read. Then go back and read another 5 or 10 minutes and go do something else. When you do that, when you read in short bursts followed by physical activity, it allows your brain to classify what you just read, and you'll actually realize that your retention goes up. Okay, good. Good study tip for you. So you're going to read chapter 1 in the book, and then you're going to go to this page, page 181 in the white book. So this is your spiral book. So we do our reading in the yellow book, but we do our testing in the spiral book. So there's 20 questions on here, 10 multiple choice and 10 vocabulary words that are matching. So you do your reading, and then you come over here and you take the test. Now, just taking a test doesn't really tell you whether you got the information you needed to get out of the chapter. So the last page in the book, page 201, is your answer key. Could you cheat? Sure. There's the answers. Go right ahead. Write them all down. Cheat if you want to. Don't do the reading. Doesn't matter to me. I'm not the one who has to take the state exam. That's on you. You will be as prepared for the test as you prepare. This is 100% on you. And when you come back to class on Wednesday, I will go down my list and I will ask, how did you do on your homework? And I'll read each one of your names, and you're going to tell me how many items you missed on page 181. And I'll write it down. I don't care. I do not care about these grades. This means absolutely nothing to anybody. But what it does tell me is if you are telling me 90, 95, 100, I know you're doing all right. But if you're telling me 60, 70, 50, I know you're not doing okay. And what can I do to help you with this topic? Okay, so it just kind of gives me a heads up on who's struggling and who's got it. So take the test as many times as you need to get 100. I don't care. I want everybody to give me 100 because that tells me that you guys all got it. Now, if you missed something, if you took the test and you graded it and you realize you missed something, take the opportunity to go back to the book and figure out why you missed it. It's not about grades. It's about comprehension. If I'm the body in the bed, I'm not going to look up at you and say, so what'd you get on chapter 4? What'd you get on the test on chapter 4? Do you think as a patient I care what you got on a test for chapter 4? No, I don't care at all. What I care is, did you learn from chapter 4 what you need to know to take care of me? That's what I care about. So it's all about comprehension. Good? I know I'm not your traditional teacher. Teachers are all about grades. I don't care about grades. I care about, did you get it? Now at the bottom here, bottom corner, you'll see a grading scale. It'll tell you if you missed 1, you got a 95. If you missed 2, you got a 90 because each question is worth 5 points. So you can either tell me how many you missed, or you can do the math and tell me what your grade is. Good? Did I lose anybody yet? All right, let's learn how to use the spiral book. So in this book, we've been working in this book today already, but now let's get to the skills part of this book. So go to page 52. Every principle that I introduce to you and every skill that I introduce to you will have this page as our very beginning starting point. It is going to tell you the principle or the skill that we're going to learn, along with a bird's eye view of everything we need to know about this. Think of this as your Cliff Notes page. Short, condensed information that gives you a good overview. This is a great page for review. Okay. So we're going to introduce the concept, but you'll come back to this for review of the concept. So going down the side, you can see the principles that are going to apply to this particular skill. Remember, principles are what we're going to learn on the back wall, and they're going to be repeated across multiple skills. So this particular skill, which is pulse, this is something we're going to learn on Wednesday. We have skill rules. So we're going to follow what tells us what to do? Care plan. Care plan, the whole care plan, and nothing but the care plan. While we're following the care plan, we should be making some observations. And who are we going to report those observations to? The nurse. So that's going to apply to this. You can see it's all spelled out there. We also have to do our opening, because we do our opening at the beginning of every single skill that we do. We're going to learn that in just a few minutes, but it sounds like this. Good morning, Miss Jones. My name is Patty. I'm your CNA today, and I'm here to take your pulse. Is that okay? Close curtain, wash hands, take the pulse. That's the opening, right? So the beginning part of the opening, or the beginning part of the skill is the opening. We also have to evaluate if we need gloves for this skill. Now, we don't have a blanket rule that we wear gloves for this skill for everybody. We don't work that way. We are smarter than that because we're professionals. We have to learn when gloves are appropriate, which is going to take up about half of Wednesday's class. We're going to learn about that. And we're going to learn how to take the pulse. So we've got some pulse specific steps we have to learn. And then we're going to end the skill the same way with the closing. That is, thank you very much, Miss Jones. Is there anything else I can get for you while I'm here? Are you comfortable? Would you like a magazine before I go? Your bed's in the low position. Your environment is clean. Here's your call light. Open the curtain. Wash my hands. Document if I need to, and wash my hands again. We'll talk about the why behind all those steps in a minute. So those principles make up this skill. So I follow the care plan, I do my opening, I evaluate if I need gloves, I use my skill specific steps, and I do my closing. So pulse just became 5 steps. Got it? That's why we use those principles, because it shortens the skills. You can see all of the skills or all the principles in detail on page 27, but we're going to learn them one by one. You don't need to go to this page. We're going to learn them as we go, but everything on that back wall is in your book on page 27. So the way that I created these principles, and this is very unique to our training program, is as I was going through all of the testing checkpoints, I realized that number 1 is the same on every single skill, no matter what it was. The very first checkpoint says, greet resident, address by name, and introduce self. Every single skill has this checkpoint. And it wasn't just number 1 that was on every one of them. It was also number 2. Which is provide explanations to resident about care before, beginning, and during care. So every skill has those 2 checkpoints, doesn't matter what they are. And didn't stop there. We also had knock before entering, knock or announce self before entering. We also had, oops, let me go back here. We also had refrain from touching resident before hands are clean. We also had open privacy curtains. So there's a lot of steps that are on every single checklist. Doesn't matter what the skill is. Get rid of the skill. Every checklist has these things on it. So what I did is I put all of those things together and made it the opening. So there are 4 principles that apply to every single skill, no matter what it is, and it's these 4. We follow the care plan, we do our opening, we evaluate gloves, and we do our closing. Always done the same way. Always. Doesn't matter what the skill is. The skill is interchangeable, these 4 are not. And that's how we're going to learn the skills, okay? So all of those principles are spelled out for you on this overview page, along with a short version of the skill and a video. And then down at the bottom is test-specific information. So this only applies to the test. That's it. It will tell you how long somebody with your level of experience should be able to perform this skill within. So if you look at this one, this is pulse. How long or how much time does somebody with your level of experience should be expected to be able to perform this skill in? 5 minutes. Okay. So they're giving us 5 minutes to do this skill. Good. 5 minutes. That doesn't mean that they're going to cut you off at 5 minutes. What they're going to do during the exam, remember this, right? This is passed around. Down here, they tell you, this is our formula for timing. They tell you, they don't say, okay, Pulse, you've got 5 minutes. They say for this skill set, you have 36 minutes to do these 3 skills, because they give you more time than just per skill. The way they do this is they take the amount of time that somebody with your level of experience should be able to do each skill in. They add those up. They give you another 5 minutes for thinking and another 3 minutes for hand washing. So plenty of time, plenty of time. So if it takes you a little more than 5 minutes to do this skill, it's okay. You've got time. You're okay. Now, what happens if you run overtime? Well, it's not an automatic fail. They're going to give you a 5-minute warning when you get to your 5 minutes before the end. And they'll tell you 5-minute warning. Now, we're going to speed up at that point and try to get as many checkpoints in as we can in that last 5 minutes, because anything without a check mark is a deficiency. So you kind of want to go on sonic speed, right? Let's move along, get as many checkpoints in. It's not an automatic fail if you go over time. You just don't get credit for anything you didn't do. Good? All right. So that's the time for each skill is going to be located in that first block. The next one will tell you, page 25, which we went to earlier. In the very top corner, this is how much time that skill set is allotting you. So it's going to be somewhere between 31 and 39 minutes for each skill set. That's why we told you guys to be back in 45. Because if we give you about 30 minutes and you about 30 minutes, it's not going to take either one of you 30 minutes to do your skills. You're going to get done quicker. So you'll probably take 15, you'll probably take 20. So we'll move on to you as soon as they're done. Make sense? Right? Okay. So what I just told you about the skills timing is on page 71. You don't need to get into that. The second position there is who's going to be your patient. Most of the time, it's a live person. One of you guys. But there are 4 skills that we do use a mannequin for. Things like dressing, pericare, partial bed bath, and catheter care are going to be done on a mannequin. Everything else is live person. That's good to know when you're practicing, because if it's a live person that you're going to do it on during the test, you want to practice on a live person when you're practicing. That's good to know for practice. The next little area will tell you where that person is going to be. Are they going to be in a chair at the beginning of the skill? Are they going to be in a bed at the beginning of the skill? Again, this is so you can set it up like the test for practice. And then the last little icon there is for documentation. Do you have to document this skill or not? There are 4 documentation skills. There's pulse, respirations, feeding, and drainage bag. You are going to get one of those 4 skills, guaranteed. Everybody does. All right. So that's the overview page. Any questions on the overview page? So now let's move on to the skills page. So this is where I'm actually going to teach you the skills. Page 53. At the top of the page, you're going to see care plan. What do we know about the care plan? What do we know about the care plan? What do we do with it? We follow it. So we're going to read the care plan, and then we're going to do whatever that care plan says. These are the care plans from the exam. So this care plan says that, patient will be lying in bed for skill. Take the patient's radial pulse, measured at the wrist, for 1 full minute and record your readings. So where's the patient going to be? In bed. What are we measuring? Can we do the respirations too for the test to show them we know how? Why? It's not in the care plan. So can I take a pulse somewhere other than the wrist, like the neck or the chest, listen to their heartbeat? Why? Not in the care plan. Do I have to write this down? Write the number down? Why? It's in the care plan. Good? Mystery unlocked, right? Okay. So the care plan is at the top of the page. Step-by-step instructions are written for you. It tells you exactly how to do this. Now, you can take this book home to any live person you have laying around. Try to find a live one. Dead ones won't help you here. Hand this book over to your live person and tell them, read the steps to me. They read the step, you do it. They read the next step, you do it. They read the next step, you do it. They read the next step, you do it. This is called forced compliance. This means that you are always practicing the right way. Did you ever learn anything in high school and they told you to go home and practice? And you went home and you had no idea if you were doing it right? You're practicing, but there's no confidence building there because you don't know if you're doing it right. That's what this is designed to overcome. If you're doing your skill the way this book tells you to do the skill, you will get every single check mark on your state exam. Every one. Perfect score. Good. Now, why couldn't you just use the checklists? Because these are written for RNs. You would have no idea if you violated an infection control principle. You need this filtered through an RN brain into easy step-by-step instructions. That's what this page is for. And guys, I am super detail-oriented. Oh my gosh, you have no idea the details that I take into account. So if it's on here, it's a step you need to do. At the bottom of the page, you're going to see the supplies that you need for this skill, and there's no way around this. You have to memorize supplies. This one's easy. Documentation form, pen, and some way to keep time. This one's easy. Some of them are not this easy. Some of them, there's lots of supplies. You have to learn them. Because as the nurse, what's your name over there? Yep. Ashante? Ashanti. So if I ask Ashanti, hey, I want you to go brush Mr. Johnson's teeth. So you're going to need to take with you a toothbrush, toothpaste, a cup of water, a towel, a set of gloves, a barrier to put it on. I'm just going to say, go brush Mr. Johnson's teeth. You're expected to know what you need to do that job. So nobody's going to tell you what supplies you need. You have to learn them. Okay. Good. All of the supplies are detailed on page 37. Note about healthcare supplies. Everything has 2 names. Everything. Some even have 3. And it gets a little complex. So I made page 37 for you so that you could see the item physically, but you can also learn like its name and its nickname. So like bath blankets or privacy blankets. Gate belts or transfer belts. Toothettes or oral swabs. Bath basin is a wash basin. Emesis basin is a kidney basin. I mean, everything has 2 names. I don't know why. I have no idea. But it is annoying. All right, and then back to page 53. Every single lesson in this book. This book is designed to be a workbook style book to get you involved in the learning. So it's not just me throwing it out there, it's you interacting with it. So every lesson in the book has some review questions. If you go through the lessons and you can fill in these review questions, you now know the information you need to be successful at that lesson. Within this book, last time I looked it up, I think there was like 800 and some odd questions in this book. But it doesn't seem that overwhelming just because, you know, like this one has 5 questions, you know. All right. So you guys all have access, or will after today's class, to our online course. The online course is designed to be interactive. So like the pages that we just went over are in there, the skills videos are in there, the introduction lessons are in there, but every lesson has an interactive activity that makes you do something with that information. And we're going to do that together here in just a few minutes with the opening. Okay. But all of you are going to have access to this lesson or this course after today. You're going to get an email that says you've been enrolled. Okay. You're going to use the username and password that you used to set up to register for class. All right. So what if I told you to do one thing for every skill and you would automatically get a ton of stuff checked off? Just one thing. This is all, you just do this one thing and you'll get 5 check marks. Would you like to learn how to do that? Yeah, that's how the opening and the closing and all the other principles we're going to learn were created. If I could just teach them to do this one thing and they did it every skill, they would get 6 check marks. And this is how we're going to build skills the easy way. So if you look at this checklist, right, this is the checklist for Pulse. When we do our opening, hi, Ms. Jones, my name is Patty. I'm your CNA today. How are you? I'm here to take your pulse. Is that okay? I'm going to close my curtain, go wash my hands. I'll be right back. When I just do that one thing, that opening, these are all the check marks I'm getting. Everything with a green on this list gets checked off with that opening. Guys, that's almost half the list. And I haven't started the skill. I haven't touched the patient. I haven't taken the pulse. People tend to focus on the pulse, forgetting that there's a whole bunch that we have to do before and after to get check marks. So when you're practicing the skill, if you're just taking the pulse without doing this, look how many check marks you're missing. Make sense? Good. Okay. So we're going to learn the opening now. This is going to be on page 30 of your book. And the opening is going to be done at the beginning of every skill we do. Doesn't matter what the skill is. Pick a skill, any skill. Anything in here is going to start with the opening. I have a video for this. It's in the online course. It's on my free website. We have all kinds of resources for you, but we're going to talk it out here in class rather than showing you a video. Notes are going to be on page 31. So 31 tells you how to. So the first thing that we do always is read our care plan. Doesn't do us any good to walk in a patient's room if we don't know why we're there. If we don't know what we're there to do. So care plan is the beginning of every skill. We read that care plan. But now we know what to do. How do we do it? That's where the opening comes in. So every skill is going to start with the opening. Every opening starts with a knock. We have to knock before we enter a patient's room. Now, there's a couple reasons for this. But for me, the main one is the psychological impact of this. Your patient is in a strange place. When you are sick, where do you want to be? Home. My comfort place. If I'm in a facility, I am not home. I am not comfortable. This is not a safe space for me. I already feel vulnerable. You guys see that? That's a psychological hit. So we've got our patients who are feeling vulnerable in an unfamiliar environment surrounded by strangers. We tend to forget when we get to work and we've worked somewhere a while, we're comfortable, we're familiar. How many guys remember the first day at work when you were a new kid on the block? Do you guys remember the anxiety you had on the first day? You don't know anybody. You don't know where anybody or anything is. You're a little unsure of yourself. You don't know who to trust. Do you guys remember that kind of new kid feeling? That's how your patient feels every day. Now, when we've gone to work for weeks, we get over that new kid feeling because now we're comfortable. We're part of the crew. We know what to do. So we forget that our patient is feeling that way. Don't forget. Don't forget. Your job is as much emotional as physical. You are going to be the one spending the most time with the patients. CNAs spend on average 10 times as many minutes with the patient as the nurses do. You are the face of healthcare. Do you guys understand the responsibility there? How many of you guys, and please don't say the name, okay? How many of you have a hospital you will not go to? Don't say the name. How many of you have had a bad experience at a doctor's office or a walk-in clinic? Okay. So when we are talking about healthcare, and we're talking about poor experiences with healthcare, was it the building you didn't like? Was it the color of the walls that you didn't like? Was it the parking that you didn't like? When you have a bad experience with healthcare, what are you actually judging on? Say it loud. How you were treated. How you were treated. If you're the one at the bedside, who are they judging the entire facility by? You. So all of you who have a hospital you would not go to, I can almost guarantee that the person or people that were responsible for giving you that impression are not even there anymore. Because healthcare is transient. We tend to go where they're paying the most. People don't normally get into healthcare and work at the same place for 60 years. So the people that you judge that facility by are probably not even there anymore. And yet you still have that impression. You still won't go there because it left a bad taste in your mouth. You are going to be the one responsible for giving that impression to other people now, because you are the front line of healthcare. So this is important. How we treat the patient is going to form their opinion of the entire organization. This is not just a nice thing to do. This is critical because that patient is scared. They're in a strange place surrounded by strange people. They are uncomfortable and they want to be home. And if we just barge in and have no appreciation, no consideration, or no respect for their need for privacy, for security, for basic decency, what kind of impression are they going to get of the facility? Negative. Would you barge in on somebody using a public toilet in Walmart? Why, when we get into healthcare, do we think it's perfectly okay to barge into somebody's room when they could be using a toilet? That's not your room. It is not your patient. It is not your hallway, and it is not your facility. This is a space the patient is renting, and they deserve privacy, and they deserve dignity, and they deserve respect. And we're going to give it to them by knocking. Do you see why I say that this is mainly psychological? But it counts way more than we think it does. Good. So we're going to knock. Now, in the test, it's considered an open door environment, even though the door is closed. Nobody out there can see your testing, what you're doing in the testing room, but it's considered open door. Open door means that I'm still going to give a courtesy knock as I'm entering the room, even if the door is open. It's courtesy. Okay. In a clinical setting, if that door is closed, I am not opening that door until somebody tells me to open that door. I'm going to knock and I'm going to wait. If I don't hear anything, I'm knocking again. If I don't hear anything, I'll crack the door a little bit and say, hey, it's Patty, the CNA. Can I come in? All clear? Are we good? If I don't hear anything, I'm going in because there's an emergency in there. Got it? But I don't just walk in. I'll tell you a story about this. This has lived with me for almost 40 years now, this scenario. When I was in nursing school, I was assigned to care for a woman who was dying of cervical cancer. She was in her 20s. It was horribly tragic. She had small children and a loving husband. And she was dying. And there wasn't anything anybody could do. So I was at the nurse's station reading the care plan and the notes and doing all the nursing things that I had to learn how to do. And I had to go into the patient's room to give her some medication. Remember, I'm a nursing student. And the door's closed. And I just walked right in. I walked in on the last intimate encounter between this dying woman and her husband. And that is not something that I can take back. That is horrible. I did not have the right to take that from them. And I've carried that with me for my entire career. When I tell you that this counts, there are things that you can do that you can't fix. What we do matters. Knock. Once we knock and we enter, we're going to greet the resident by name. Now, this is a very specific checkpoint. It actually says that we cannot use words like honey, sweetie, dear, love. We cannot use terms of endearment. It has to be their name. And that's the best way to identify somebody. What's your name? Tiana. So this is Tiana. Everybody say hi to Tiana. Hi, Tiana. So if I walked into Tiana's room and I said, so hi, Ashante, how are you? What are you going to tell me?
I'm going to tell you that's not my name.
Okay, you're going to be very clear that that is not who you are because you don't want what I have in store for Ashanti. You don't know what she's got going on or what I'm about to stick where, right? Because healthcare is invasive. You're going to make sure I know who you are. The best way to identify somebody is to call them by name. They will self-identify. Now, some of you are saying, but wait, what if they have dementia? What if they can't identify? What if they can't speak? What if? What area can we go to find the answers to our what if questions? The care plan. It's already been addressed. What if it's not in the care plan and it's a concern? We go to the nurse. So the process is already set up for us. So we're going to, and then walk in and say, hi, Mrs. Jones. Now for the test, everybody is Mr. and Mrs. Jones. We use one name. We make it super easy. Hi, Mrs. Jones. But we're not going to say, hi, love, hi, dear, hi, sweetie. Those people don't live here. They don't work here. They don't exist here. Good? Good. All right. So we knock. It's a checkpoint. We greet our resident. That's a checkpoint. So good morning, good afternoon, hi, hello. We're nice. We're the nice crew. We're nice. We're going to identify them by name. We don't use ID bands for the test. If you use them in a clinical setting, they'll train you how to use them, but they don't exist for us in the test. Calling somebody by name, much better, much more accurate. It's a graded checkpoint. Don't call them by an endearment. And then they have to know who you are. And you don't just say, hey, I'm Patty. So, Patty who? Are you Patty the person that brings the cookies? Are you Patty the person that brings the needles? I mean, I'm going to react to those two people a little different, right? Right? So just saying, hey, I'm Patty doesn't mean anything. It's, I'm Patty, your CNA today. Ah, okay, you have a role. You are now important to me. I now know how to relate to you. So we don't just tell them our name, we tell them our name and title. Good? It's a graded checkpoint. Then we're going to tell them what we're there to do. I'm here to whatever. What are you here for? Read it off the care plan. And you can put this in your own words. I'm here to take your pulse. I'm here to do some exercises. I'm here to get you up into the wheelchair. I'm here to clean you up down below, however you want to say it. Or you can read it right off the care plan. I'm here to measure and record pulse. Either way for the test is fine. If you're nervous, and you will be for the test, you can read it off the care plan. Perfectly okay. If you're confident and comfortable in your skills, put it in your own words. I'm here to take your pulse. And then we're going to get, that's a graded checkpoint. And then we're going to get the most important thing from the patient, consent. Patients have the right to say no. What does no mean? No. Works in this context too. You do not put your hands on anybody in any setting for any reason without their consent. Because if I put my hands on you at Walmart, I can be charged with battery. If I put my hands on her in a nursing home, I can still be charged with battery. Some of you are saying, but wait, Miss Patty, what about dementia patients? That's going to be indicated in the care plan. Okay. Good. But we are going to get consent from all of our patients for the test, unless our care plan says otherwise. So we're going to ask the most important question of all, is that okay? And that is a graded checkpoint. Then we're going to close our patient's privacy curtain. Now, these curtains for the test do not go all the way around the bed on purpose because you're being tested. We have to see what you're doing. So if the curtain went all the way around the bed, the evaluators wouldn't be able to see. So most of the time for the exam, oh, I remember now, Jake, why we had this over. Ugh. Okay. So for the exam, the curtain's only going to come out a little bit. That still leaves the evaluator's area to be able to see. This is perfectly okay to simulate, to show that we understand privacy is important. But let's talk about these curtains in a clinical setting, right? They are between beds. They're between the bed and the door, right? Who touches these curtains? Who? Everybody. Patients touch the curtain after scratching what itches? Staff members touch the curtain with dirty gloves.
That makes sense why you wash your hands after you put it like it.
Right. If I were to put a black light on this thing, it would glow like, you know, there's no tomorrow. It's got all kinds of body fluids on it. And this one's in a classroom setting. Still has a lot of stuff on it. They're only taken down and laundered about once a year in a clinical setting. Now, in between patients, housekeeping does spray it with a disinfectant spray. And this is no shame on housekeeping at all. It's just the way things are done. As caregivers, we need to know that this is not considered clean. So once we close the curtain for privacy, what do we want to do? Wash our hands. Good? Questions? Did you learn something?
Yeah, that was one of my questions before, but I was going to see.
It is a graded checkpoint. Okay. So one of the biggest things with this opening, one of what we call the critical checkpoints, the one thing you don't want to miss, okay, the one thing you don't want to mess up on the opening is, well, hold on. I got ahead of myself. Sorry. So we're going to close the curtain for privacy, go wash our hands. We talked about that. And then we're going to go get our supplies. You have to have clean hands to get your clean supplies. Okay. But the one critical checkpoint that we want to make sure that we don't miss is that we cannot touch our patient until our hands are clean. That is a critical checkpoint. So if I walk in the room and I say, so Miss Jones, how are you today? You doing okay? All right, my name's Patty. I'm going to get your pulse. I have failed. What did I fail? Yep, you touched your patient with unclean hands. Why is that a problem? Well, remember I said earlier, get you all settled here, Miss Jones. Remember I said earlier that patients have to prove that they're sick enough to be here? That means that we put the sickest people in the community all under one roof. They're already sick. So their immune systems are already occupied. Their immune systems are busy. But we put them right next door in spitting distance of another sick person who has different pathogens. Now, this person isn't really interacting with that person too much. Like they're not playing gin rummy or anything. But if I'm working on this one and then I work on that one without washing my hands in between, what did I do? That's right. I transferred pathogens from one person to another. And if their immune system is already busy, who's going to fight off this new germ? That's a problem, isn't it? It is such a big problem that in hospitals, 1 out of every 25 people catches something they did not come in with. I don't know about you, but I don't like those odds. That's like saying that 1 out of every people that ride roller coaster, every time it goes around, has about 25 seats. One of those people that ride the roller coaster is going to fall out. Would you get on the roller coaster? Those aren't very good odds. So it's even worse when we understand that 1 out of every 12 of those is going to die from the new infection. So out of every 25 people that ride the roller coaster fall out, 1 out of every 12 of those die. The rest of them just get injured. It's horrible. We've got to do better than that. That's why this rule exists. And that's why it's a critical checkpoint. If you miss anything else, don't miss that one. Don't touch that patient until your hands are clean. Good? Questions? Okay, so what am I doing on time? Okay, so in the online course, we talked about the online course a little while ago, right? In the online course, we have a lesson on the opening. So I have a whole video on this that you can go watch. You guys all have access to this now. It's on courses.foryourcna.com. But below that video is going to be this. This is an interactive activity. And it's a drag and drop activity. So what we're going to do is we're going to take our mouse or our fingers, if you're on your phone, and you're going to grab the wording. Don't grab the picture, grab the actual wording. And we're going to move these tiles until they're in the right order. And we're going to do this together in class right now, okay? So if we're looking at this opening activity, we're going to grab the bottom part of the card and drag it into the correct order. So what step comes first? What do we need to know in order to do this skill? We have to read the care plan first. So I'm going to grab that care plan and bring it up to the very first position there. Now what do we want to do? Knock. So we're going to drag the knock card up to that position. Now what do you want to do? Okay, so we want to greet our patient and identify them. And now what do they need to know about us? Okay, we want to say our name and title. I always think about that. Say my name. I can't sing, but now what do you want to do? Explain task. Okay. What comes first? Curtain or hand washing? Curtain. And then wash your hands and then gather your supplies. So now that I've got everything in the right order, or what I think is the right order, we're going to click this check button and we're hoping for a gold star. Let's see. Yep, we got a gold star. Now, if we got something in the wrong order, it would have a retry button there. When we hit retry, it's going to scramble all of them. It doesn't leave the right ones you got to do it all again. And you can do this as many times as you want to be able to really reinforce the order of this. What I suggest to students is that tonight when you go home, you write these out on an index card. Okay, just go grab an index card, a piece of paper, put it on the back of a receipt. I don't care what you put it on, but knock, greet your patient, identify them by name, introduce yourself by name and title, explain the task, get permission, close curtain, wash hands, right? Put those steps on your paper, tape it to your mirror in your bathroom. Every time you walk in that bathroom, you've got a door to knock on. You've got somebody to talk to, the one in the mirror, and you've got a curtain you can close, the shower curtain. You've got a sink right there to wash your hands. So every time you walk in your bathroom for the next week, you should be doing the opening. Oh, yeah. Everybody in the house will think you're nuts. But if you do what I'm telling you to do, by the time we get into skills, you're not going to have to try to learn this along with skills. You'll have this down. I can do the opening in my sleep. Knock, knock, knock. Hi, Miss Jones. My name is Patty. I'm your CNA today. I'm here to whatever. Is that okay? Close curtain, wash hands. Okay, I can do it in my sleep because I've done it over and over and over and over again. But let me tell you what, when I go to the test, now remember, I'm a subject matter expert in this. Okay, I know more about prometric testing than most evaluators because I've made this my mission over the last 20 years to learn about the test. But if I were the one testing, I would still be nervous. Now, I know more than they do, but I would still be nervous. Why? Why? Even though I've got the knowledge and I've got the experience, why would I be nervous? Okay, I'm still being judged. That's correct. I'm being watched and judged. And there's a lot riding on the line, isn't there? Pressure is on. So understand that I know the pressure that you're under. However, if you get this down where it's just rote, you just knock, knock, knock. Hi, Miss Jones. My name is Patty. I'm your CNA today. I'm here to whatever. Is that okay? Close curtain, wash hands. If you can keep going, if you can do that, it doesn't matter how nervous you are, you have a starting point for the test. That's the hardest part, is starting. From there, you can roll into the skill. You'll get into a rhythm. You'll be okay. It's the starting that's hard when you're under pressure. So we make it easy. All you got to do is memorize this and be able to do it in your sleep. Okay? Good? Good? Okay. All right. So that's the opening. Knock, knock, knock. Hi, Miss Jones. My name is Patty. I'm your CNA today. I'm here to whatever. Is that okay? I'm going to close your curtain, wash my hands, get my supplies. I'll be right back.
When it comes to introducing yourself, does it matter if you use your last name or your first name, or do they prefer one of those?
Just use your first name for the test. In a clinical setting, most of the time we don't use last names just because of identification security, right? That being said, that there are situations, there are settings where I have been known as nurse. At the time, it was my last name was Ramsey, Nurse Ramsey, or now it would be Nurse Laramee. Okay, so there you'll go by your facility policy for that. But particularly when we're working in mental health, a lot of times we want a little bit more formal mindset, more formal patient interactions. All right. So one thing will get you all of those check marks, right? So we do our opening, we get half of our check list checked off. We're going to do the same thing with closing. One thing, we're going to learn one thing and get a ton of check marks. So we're going to get, in this case, we're going to get 5 checkpoints for our closing for this skill. There are other skills where we get a whole, when we do the closing, we get like 10 checkpoints checked off. All right, so what is the closing? Page 34, we'll go over the overview. Page 35 is the specifics. But you can kind of boil the closing down into 8 C's. Closing starts with C, and there's 8 C's to the closing. So the first is clean and safe. So we want to make sure that we look around our environment and make sure it's clean. People rest better in a clean environment. Clutter can be very distracting, especially if somebody has anxiety. They'll focus on the fact that there's used Kleenexes on their table, and that becomes their whole focus because they have nothing else to focus on, and it'll just get under their skin, and they'll get on the call light and fuss at you because there's Kleenexes that need to be thrown away. Look around. Is the environment clean? We also want to make sure the patient is safe. Safe means the bed needs to be in the low position, the patient needs to be in the middle of the bed, and there's no obstacles. Clean and safe. So this really is about taking a step back and looking at the patient. Just look at them. How do they look? These are all testing checkpoints. Bed has to be in the lowest position. Now, these beds do adjust. You can raise them up. There's a crank at the bottom of the bed. You can raise it up to a comfortable working height. That way you don't have to bend. And that's great for people that are tall. You know, you don't have to bend. Me, I don't raise the bed. I'm not that tall. I don't have to bend all that much. Some of you may want to raise the bed during the test. Perfectly okay. You're allowed to do that. No problem. But if you raise the bed, for your comfort, you have to remember to lower it at the end of the skill because it becomes a safety problem. Now, why would it be a safety problem? I'm not worried about this patient rolling out of bed. They've been in a bed their whole life. They know how these things work, okay? I'm not worried about them rolling out. What I'm worried about, when you go to bed at night and you swing your legs into bed and you go to sleep and you're dead to the world for 6, 8 hours, whatever it is, when you wake up, you're groggy. You are not fully with it yet. You are not looking around for potential dangers. You swing your legs out, and every day of your life up to this point, when you swung your legs out, that floor was right where you left it. That floor has never moved a day in your life, ever. It's predictable. You wouldn't even think about, is the floor there? Why would you? Because it's never moved. You just swing your legs out and the blind hope that the floor is there. Right? Blind confidence. But if I raise this bed up to a comfortable working height and I didn't address that at the end, when this patient goes to get out of bed and they expect that floor to be there and it's not, what's going to happen? Yeah, they're going to fall. Absolutely. This has nothing to do with the patient rolling out of bed. This has to do with nobody expects the floor to move. Good? Make sense? So if you raise the bed up to a comfortable working height, which you can, make sure you lower it at the end. So you're putting the floor back where the patient expects it to be. That is a testing checkpoint. We're going to ask the patient if they're comfortable. They need to hear this word. Are you comfortable? They need to hear the word. Are you comfortable? But it's not just about physical comfort. This is also about emotional comfort. So physical comfort is a checkpoint, but so are preferences, which is emotional comfort. So for the test, we're just going to offer a magazine. Would you like a magazine? You could also offer the TV remote or their cell phone. But for the test, we just keep it simple. One thing, just one thing to remember. Would you like a magazine? Okay, that is a testing checkpoint. So not just physical comfort, but emotional comfort as well. You want to make sure the patient is covered at the end of the skill. And the way that I say this is no knobby knees. I should never see knobby knees. Your patient is in bed, in a gown, not dressed for company, right? They are laying down, which means they're feeling vulnerable. So they're poorly dressed and feeling vulnerable. Now take their sheet away. How uncomfortable do you think they feel emotionally? Very. So you want to make sure they're covered in something. Sheet, clothing, something. But if I see their knees, that's way too exposed. It's not like Victorian era. This has more to do with emotional comfort and vulnerability of the patient. Good? Make sense? Okay. That is a graded checkpoint. We're going to open the privacy curtain. Now, I get a lot of pushback on this. What if the patient wants the curtain closed? Well, that's fine. Leave the curtain closed. But who should know? Who should I tell? The nurse. Why do I have to tell the nurse that the patient doesn't want the privacy curtain open? Because closed curtains all the time breed isolation. Isolation leads to depression. Depression leads to a decrease in healing, a decrease in intake, a decrease in will to live, which will ultimately impact my patient's ability to heal. So if they don't want that curtain opened, people are social creatures. We tend to interact with others, even if that just means we're looking at them. People are social. Now, I'm probably the least social person. I hibernate in my office for days. But still, if I'm in a clinical setting, isolation will breed depression. You have to think about the mental mindset of our patients. Make sense? Open the curtain. If they don't want it open, we have to report that. So we're going to open the curtain at the end. That is a testing checkpoint. And then we're going to give them their call light. It doesn't matter whether you give them the call light before you touch the curtain. It doesn't matter. That call light is just as dirty as that curtain. Patients in bed scratch what itches and then hit the call light to tell you about it. Okay. Curtain is dirty. The call light is dirty. It doesn't matter what you touch first. Everything here has been contaminated with the patient's cooties. Just get all of those things done. Okay. So clean, comfort, curtain, call light, comfortable. Get all of that stuff done. Once you've done all of that, it is a graded checkpoint. Then we're going to go wash those cooties away. So we're going to go clean our hands. After we've cleaned the patient's cooties off of our hands, if we have to document, we're going to document after hand washing because that pen is going to go in my pocket. It goes in and out of patients' rooms and it probably goes home with me at the end of the day. I don't want to touch that pen with cooties. I don't want those cooties in my house. I don't want them in my pocket. So we wash our hands before we touch our pen. And then after we touched our pen, after we have documented, then we're going to wash our hands again. And this one is critical. Remember I said with the opening, you have to wash your hands before you touch the patient, right? Well, this time we have to end skill with clean hands. That means that washing our hands is the very last action we take at the end of every single skill before we say my skill is done. Very last action. Because any cooties that I picked up in this environment, any cooties that were on the pen or the documentation form, I want a clean slate when I walk out of this patient's room. Because I don't know if there's cookies waiting for me at the nurse's station or a patient that fell on the floor waiting for me.
So we will wash our hands, document.
Wash our hands again. Yep. So end skill with clean hands is our checkpoint. Good. So my closing sounds like this. Thank you very much, Ms. Jones. Is there anything else I can get for you while I'm here? Are you comfortable? Would you like a magazine before I go? Your bed's in the low position. Your environment is clean. Here's your call light. If you need anything at all, please let me know. I have to adjust your head because you just look funny. There we go. Now I'm going to open the curtain, go wash my hands, document if I need to, wash my hands again. My skill is done. So the closing is a little bit longer. Okay. So the opening is done at the beginning of every skill. Our closing is done at the end of every skill. Doesn't matter what the skill is. Those two together will make up about half of the checkpoints for every skill we do. We get half of our check marks just by doing those two things. Okay. Remember, you have to end the skill with clean hands, but also with a patient that feels cared for and cared about. All right. So if you look at pulse, we did our opening and we did our closing, and that is about half of our checklist, and we haven't even gotten to the pulse yet. Make sense? So we're going to use this strategy for all of the skills that we're going to learn from this point on. We're going to do our opening. We're going to follow the care plan. We're going to do the skill according to whatever we have to do, and then we're going to do the closing. And the opening and the closing are going to get us about half of our checkpoints. Okay. So now, since we have to wash our hands at the beginning of every skill and at the end of every skill, let's learn how to wash our hands appropriately. So page 44 is going to go over our overview of how to wash hands. And our details are on page 45. Pathogens, or bad guys, need three things in an environment, and most pathogens need three things in order to thrive: warm, dark, and moist. As healthcare providers, we should always be looking for warm, dark, moist environments. Those are like danger zones: warm, dark, and moist. Well, bathrooms fit that criteria perfectly. Bathrooms are usually about 2 or 3 degrees warmer than other environments because we don't like to be chilled when we get out of the shower. Bathrooms are usually dark because mom trained you, turn the light off when you leave the bathroom. We don't need to light up a bathroom if nobody's in there. And when we go into the bathroom, we're usually using the toilet and washing our hands, so there is already moisture in the area. So bathrooms are the ideal breeding environment for pathogens. They're warm, they're dark, and they're moist. And bonus, we actually drop bacteria off there usually every day. So there's already bacteria in this environment. Good? Make sense? All right. So we have to keep this in mind when we're learning how to wash our hands, because we don't want to add to this warm, dark, moist environment needlessly. So I'm going to show you how to wash your hands, right? We're going to learn the steps, and they're going to meet the checklist criteria. But more importantly, they're not going to, these steps are designed to help break that chain of infection. All right, so when we go to wash our hands, we're going to approach the faucet, and we can touch the faucet with our unclean hands. There's no problem there. And that's because my hands aren't clean, the faucet's not clean. Those two things are the same. I can touch the faucet. Once my hands are clean, though, can I touch that faucet? No, because it's not clean. So we're going to turn the water on. Just get whatever is comfortable for you, warm, cold, whatever you like. Get the water comfortable. And then you're going to wet your hands. This is actually a graded checkpoint. Do not put soap on dry hands. It's not going to spread well. You have to wet your hands before you put soap on. So we wet our hands, we apply some soap, and we have to apply enough to work up a lather. So if you just get a little bit of soap, it's not enough. They want to see bubbles. You're actually graded on bubbles for the test. Get enough soap to make bubbles. And then we're going to bring our hands together and we're going to start rubbing. And we need to rub for at least 20 seconds. And they are using a clock right above the sink to time you. Not a song, not ABCs. They are using a clock, which means that we should also use a clock to time ourselves, 20 seconds. As we're rubbing, we're going to rub the tops of our hands around the wrists. We're going to rub the backs of our hands in between our fingers. We're going to rub down in between the thumb and index finger, in between each finger, all of these areas down here by our pinky, all of these areas for at least 20 seconds. For rub, 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 all of those areas. And then we're going to go down each one of our fingers with our thumb to get the cuticles. And then we'll circle our hands on the palm of our hands to get underneath our nails. So these are our areas: the wrists, the backs of the hands, in between our hands by lacing our fingers, in between the thumb and index finger, that webbing, and the back of our hand by our pinky. We're going to rub all of those areas for at least 20 seconds. These are the areas that are frequently missed. In between our ring and pinky finger, and in between our ring and middle finger, this little area often gets missed. Thumbs get missed a lot, particularly the webbing here. So you want to pay attention to those areas when you're washing. You're going to use a clock to time yourself. You're not going to sing. And you have to rub for at least 20 seconds before you move down to your nails. Once you've cleaned your nails, by taking your thumb down each one to clean the cuticles and rubbing your nails on the palm of your hand, then you can rinse. Now, when we rinse, we want to keep our hands in the sink, lower than our elbows, and rinse thoroughly, but don't touch the sink or the faucet. Your hands are clean. Those areas are not. After rinsing, you're going to tap to keep the water in the sink instead of doing this. Remember that warm, dark, moist? We don't want water in the environment. So we tap to keep the water in the sink, not in the environment. After tapping, you're going to dry. Doesn't matter how many paper towels you need. You've got small hands, use 2. You've got big hands, use 10. Nobody cares. Nobody's counting. Just dry your hands and throw those paper towels away. After drying your hands, only touching what's clean, and throwing that paper towel away, then you're going to get a clean, dry paper towel to turn the faucet off. That faucet is going to stay running until your hands are dry. You cannot use a wet paper towel to turn that faucet off. Wet paper towels rip. You'll contaminate your hands and bring that contamination to your patient who already has a busy immune system. Good? Okay. All right. So Jake is going to show you this video here real quick. And then what do we got on time? Okay. It's a 2-minute video. And then we're going to do the activity together really quickly. I may keep you 1 or 2 minutes after, so just bear with me. But Jake, can you put hand washing on, please? As I approach the sink, I can touch the faucet with my unclean hands because the faucet is not clean. I'm going to turn the water on to a comfortable temperature and wet my hands thoroughly. You must rub with friction for at least 20 seconds. I'll get enough soap to produce a nice rich lather and bring my hands together to start timing. I'm going to rub the tops of my wrists on both sides, the back of my hands, interlacing my fingers, in between my thumb and index finger, making sure that I cover all areas with sufficient friction. The bottom of my hand by my pinky and the palm of my hand. After cleaning my hands, I'm going to go down my fingers with my thumb to clean the cuticles. I'm going to circle my nails on the palm of my hand and then rinse. Being careful not to touch the faucet or the inside of the sink. After rinsing, I'll tap to keep the water confined in the sink and then dry my hands thoroughly with paper towels, being careful not to touch the unwashed portion of my lower arms. I'll throw those away and get a clean dry paper towel to turn the faucet off because wet paper towels may rip and contaminate your hands. As I'm doing it, you're going to see the actual checkpoint on the screen. And I'll point that out to you again on Wednesday. All right, so let's put these steps in order here. This, again, is a lesson in the online course. Again, we've got a sequencing. So our first step here is to turn the water on. Then we're going to wet our hands. We're going to apply soap. We're going to lather all surfaces. We're going to rub for at least 20 seconds. We're going to rinse all surfaces. We'll turn the water, we'll dry our hands and then turn the water off with a barrier. Once we get them all set, we're going to check and make sure that we got them all correct. So we have a sequencing activity for this as well. So for the test, please make sure that you aren't singing. You're using the clock for timing. During the test, we're going to talk about this a little bit more on Wednesday, but after your first skill. So your first skill, you're going to wash your hands at the beginning of the skill during your opening. You're going to wash your hands at the end of the skill during your closing with real water, real soap, and a real sink, really for real. After that, they're going to tell you can simulate hand washing. Simulate just means say. Where do those evaluators want to be? At home in their pools, drinking their margaritas. They don't want to be watching you wash your hands. 6 times. And do that by 8 students. Oh my gosh, it's like a whole day of watching people wash their hands. How boring. It's like watching paint dry. So they're just going to watch you do it twice, once at the beginning of the skill, once at the end of the skill, and then from then on, you can just say when you would wash your hands. Okay. All right, indirect care. This is also graded on the test, but it really kind of boils down to treat the patient the way you would want to be treated if you were the one in the bed. Be nice. Be nice. We've talked about this quite a bit. Page 28 is going to talk about indirect care as well. You won't find indirect care on the Prometric checklist. It's a separate document. But these that we passed around, these have indirect care built right in. So if you're using these in the classroom to check each other off, all the indirect care steps are already in there for you. But really, it kind of deals with standard precautions, infection control, comfort needs, patient rights, and safety awareness. All of these indirect care checkpoints are going to be detailed in each skill automatically. But it really kind of boils down to treat the patient the way you would want to be treated. All right, homework for tonight. You're going to read chapter 1 in the yellow book. You're going to take the test on page 181 in your spiral book, and then you're going to grade it using page 201 in your spiral book. When you come back to class on Wednesday, I'll ask you, how did you do on chapter 1? And I'll go through my list and you'll tell me what your scores were or how many you missed. If you have any questions in the reading, write them down, bring them to class on Wednesday. I'll be happy to answer your questions. CPR is not part of this class. We don't do CPR in this class. You don't need it for the class. You do not need it for the test. You will need it to work. You're going to have CPR in order to get a job in healthcare. We recommend Julie. This is her classroom. So this is the QR code. You also have it on your first day handout, the blue the page with the blue on the top. This is her QR code. She gives you guys a discount. So if you scan that code, it'll bring up the next session she has, and she'll give you a discount if you use that code to register. You have to go through that portal to register for your discount. All right, you're going to get a wrap-up email after class today. You probably will want to at least bookmark your, the replays of this in case you need to watch it later. Make sure you. Yeah.
And it also just sent out a few moments ago.
Now, your t-shirts, you need to wear your t-shirts to class starting on Wednesday. On the t-shirt, on the front, has a logo like this. There's a QR code on there. That QR code is to the replay page. It's built into your shirt. But the back of your shirt, if you look in the big letters, remember how I said everything on the back wall is what we're going to be learning? They're in those big letters. If you look at the number 4, you'll actually see skill rules in the opening. So that shirt is a cheat shirt. Has everything you need to know for the test in the shirt.
Will they throw me out if I wear my shirt to the test?
They won't, and that's why we put it on the back, because you can't read it during the test. I haven't heard of anybody being thrown out. But, you may have to turn it inside out. I don't know. All right. Anybody have any questions before I release you into the wild? No? Everybody okay with today? Did I go too fast? Okay. We'll see you back here at 9 o'clock on Wednesday. Have a fantastic day. Do something fun. Bye-bye. Those of you who joined us virtually, thank you so much for joining, and we will see you on Wednesday at 9 a.m. for Class 2. Until next time, happy caregiving. Bye.